Now, some questions actually came and people were asking. Now, like
I'm not seeing any slideshow, ma.
Okay, let's see. We just have one slide today, and that is a video. I was just talking in the surface, so maybe network. Please, oh God, please, God have mercy on us today. Can we see that slide? How to treat burns?
Yes, you can see it too clearly.
So that's just, like I said, we are not going to have too many slides on the show because we want to complete what we have. Today is the last day, so we don't have too many slides. But trust me, I'll do what I know how to do best. I'll ensure that you all have everything detailed. Now, I had a couple of some concerns on the platform of maybe one or two people saying they weren't able to access the video. I was only just wondering because it has taken since I think I dropped that on I can't really vividly say, maybe Monday or thereabouts. I can't, Sunday, I can't remember exactly the last slides, the day I dropped them. So I expected feedback, but nevertheless, I don't know if it is a general problem. So after the training, please, I'd like you to reach out to the chats, to our WhatsApp group, and confirm if you were actually able to download the video, as in download the slides. The one on communication that starts with communication, I think that was day 3, and the one that starts with the dementia, that starts with the umbrella that talks about types of dementia. So those two in particular. So if you have any challenge with it, please do not hesitate, because the communication is actually bulky. So for those that have their devices, they don't have a large volume of their memory card is not heavy. It may have 1 or 2 challenges. I just feel so. But on my end, I'm able to open it. After that message I saw, I was able to open it and play the video. It was very clear. So it depends on your storage capacity. It depends on whether you have data and a whole lot of things, technology. But nevertheless, I wouldn't be happy if I actually took time to put together those slides and the video and people were having challenges. No, I wouldn't be happy. I need everyone to be happy, to really get value for what you paid for. So that having said, we were saying that we did a couple of things yesterday. We talked about vital signs, and there was like, which blood pressure, I beg your pardon, which blood pressure is normal, which is not normal. And I did say summarily that as a certified nurse assistant, you are not to, you are only to know, to have that right knowledge. That's why we are going extra mile, to have that right knowledge, because a couple of you would want to progress in the nursing hierarchy. You wouldn't want to end as a CNA. You may want to get to registered nurse and move higher. So it's important you have this first knowledge before you progress to go further in the ladder and get higher education. So for blood pressure, there are things that affect blood pressure. My own blood pressure, what you consider normal for a person that lives a sedentary life, that's a life that the person does not really do much activities that keeps you hyper. You cannot equate it with taking a person's blood pressure that is an athlete, maybe someone that is jogging, or someone that is always busy, always on the run, doing exercises, doing this and this. There will definitely be a diversity in it. So it depends on what you have as the diastolic, what you have as the systolic. It depends on the figures that you actually see at the end of the day. The two put together is what will tell you whether a blood pressure is low or not. You could have variations depending on the lifestyle of a person. That's just the summary of it all. Up until now, like I was telling you, I don't know if I made that illustration some years ago. Yes, I did. I think I said it when I went to the hospital, and my blood pressure was taken, and I had a low blood pressure. According to the certified nurse, the nurse assistant that actually did it, she said, why is your blood pressure low? And I became scared, as a human being. I was like, oh God, what's happening to me? Why should my blood pressure be low and all that? Until we got to the doctor, and I told the doctor, my blood pressure is low. I'm just wondering what could be. And the doctor was immediately, told your blood pressure is low, and it created a lot of things that I was just trying to see how to nip in the bud so that it doesn't affect. So what am I saying? We're not expected to tell the patients, about his or her health status, or considering, blood pressure being on very high and very low affects people mentality. It affects you emotionally. If they tell you that your BP is very low, and some people don't even know how to communicate, they just give you the way it is. Your BP is very low. This is not good, or you can easily slump. You can slump, and of course, like Nurse told me, and of course, low blood pressure is worse than someone having high blood pressure. So all these things, the thing just puts me off instantly. I felt emotionally destabilized because, of course, nobody wants anything to happen. So these are things that we have to, that we treated yesterday. Like we said, it's very easy to use the normal, the digital machine that we use to check the blood pressure. That's easier. The other one we had, the one with that you have to check, and then that one takes a lot of work and a lot of, but thank God for technology. There are other ways to other machines that are handy. You can just buy them, keep in your house. You check your blood pressure, check everything that you need to check. So we also looked at dressing a client with affected hand yesterday, on dressing and dressing. Today, we are going to look at some other aspects. And again, we are going to continue our first aid from where we stopped yesterday. Like I told you, the first part will continue today. We'll conclude the first aid part of it, aspect of it, and also we'll enter part B, which is continuation of those skills that we learned. We didn't do, I think we did up to half yesterday, if I'm not mistaken. So we are definitely going to continue. So we have a lot of things to do today. So quickly, as fast as possible, before we delve into, I was just trying to see how, okay, 22, fine. We have about 13 people that are still lagging behind. That's fine. So we want to just quickly, we are going to look at burns. Now, how to treat burns is just a video. The way I like to do my trainings, I like to ensure that I talk, I give you the slides, I give you the video, you see the practicals. Then with all those things put together, then I don't know what else that you may need to excel. Yes, I know you talked about the practicals, and I just trust God that somehow you have a way to actually put it to tests, what you have learned. So let's quickly see this video. Please, I need to know if you are with me. Please, let's take this thing off. If we are together, because let's just quickly, what we are going to watch is just a video. It's just a video of what you can do when you have burns. There are so many schools of thought. Some people say, do this. Some people will say, do this, rub this, flush, use this, use egg, break egg. First aid, like we are talking about first aid in this case. We've had the traditional first aid. We've had the traditional first aid whereby in the days of our mothers and our fathers, in those days, they'll say, if something happens, like I remember when I pricked my nail, my foot, rather, a nail just pierced my foot. And then my grandmothers at that time just quickly told me, when I shouted and screamed and I was in pain, she just said they brought me. She had to take one hot knife and placed it on the fire. I cannot forget those things, We have a lot of stories to tell, really, in your growing up. There are some memories that you still keep. So they had to use the hot knife on the fire. It was very, very hot, very as hot as anything. Then they use that hot knife. And you can imagine when that touches you, you understand. In fact, the nail will just, even if the nail is there, just the hotness of that thing will make the nail to come out immediately. So you see, these are traditional methods that have not been proven. We just do it. Some will say, look for scent leaf, just squeeze it, just squeeze the scent leaf, take out the water, and these are traditional methods. So let's just look at this video, and I believe that we'll be able to.
Have you ever spent too much time out in the sun and forgot to apply sunblock? Scalded your... Have you ever spent too much time...
Okay, is it okay? Is it loud enough?
Yes, ma. Okay.
Yes, ma.
Okay, so let's just see. Practically, there are things we don't have to talk too much. When you just see, you learn one or two things.
I'm out in the sun and forgot to apply sunblock. Scald your arm after touching a hot pan or spilled coffee on yourself accidentally. The severity of burns are categorized into first, second, and third degrees. For minor burns, which is first or second lower degree, this is treatable at home, while others have to be treated in a medical facility. Directly after receiving a burn, place the affected area under cool water for 10 to 15 minutes or until the pain eases. This is to stop the burn from spreading to the surrounding area. Remove items such as rings or tight jewelry from the affected area. Do this before the swelling starts. Apply a thin layer of aloe vera lotion on the burnt area to help soothe the pain and promote healing. Make sure the affected area is kept clean and dry to prevent infection. If the burn has an open wound, clean and dress the wound like how you would for a small cut or abrasion. Do not apply butter or ice on the wound, as it might set the affected area up for frostbites or infections. This video is a guide for basic first aid. If you are unsure about what to do, visit your nearest medical facility immediately.
Okay, so practically, that's a short video because I didn't want to come up with a video that is very long so that you will not have issues in downloading or maybe opening it with the issue a couple of us have already. So, so that's practically how we can handle burn. There are some things, briefly, before we move, there are some things that traditionally it's people do or is supposed to be done when you have burns. So I don't know if we have any experience on the platform before we move to our practicals, continuation of the first aid. Do we have any experiences or do we have any contributions to add to that video to further explain how we can treat burns? Because I know we have people here. Martha, you have something to say as regards that? Martha Awodi.
Hello.
Yeah. Okay. Thank you. Go ahead.
Can you hear me?
Yes, I can. I can hear you, Martha. Go ahead.
Like what you said when you were very young, that your mom or your grandmom used a hot oil on a knife to treat your
Palm
wound.
oil.
Palm oil to treat
Yes.
your wound. Now, as a medical doctor, can you use on your hand?
That is why I am saying that. You know, when I said those things, I said that in the days of our parents, that we do a lot of traditional methods of treatment. I don't know if you understand. That those ones are not, they've not been proven to be right. Medically, it's not proper to do those things. You understand? But that time, then I didn't have the right knowledge. And aside that, it was just the in thing then, you know, in the village and all that. They'll just say, bring this, or they'll say, take stone, hit that area where there is, so that place will be solved, different things. So for now, as we speak, no, that's not right. It's not, we don't follow the traditional method medically. We use the methods that have been proven to be right and to be correct. So the reason I was calling you Martha was, you know, I actually saw what you dropped on the platform, and perhaps you're already in the, perhaps you are already, because we have some people that are already certified nurse assistants here. They just, perhaps for one reason or the other, they just need the certification. So those are the people I actually want them to tell us, to contribute to that video and tell us how, whether there are other methods we could handle that, Martha. So not only Martha, anybody, the floor is open. Is there any contribution, or is there any time that something has actually happened to you on your hand and something happened? What did you do? What were you asked to do? I just need us to rub minds for a few minutes.
All right. So I have
Good evening, ma.
hello, can I go?
Good evening. Please hold on.
Patience.
Martha,
Please, patience.
Okay. Okay, Martha, I'm done with Martha. Okay, Patience. If Martha is done, go ahead, Patience.
Okay, so for burn, maybe you are cooking in the kitchen and you know any kind of burn, whether it's oil, water, within few seconds of that burn, traditional method that I've learned from my mom and which I think works is to immediately add salt to the injury.
And they say don't add salt to it.
Yeah, don't add salt to the injury, but you just add salt to that area. What it will do is that it will not degenerate into having bag of water. And if done, within those few seconds, it will just help dry up the surface. Yes, it's likely to be uncomfortable, within the first few minutes, but after a while, it cools down. If it's a severe burn and you also add salt before, taking the person to the hospital, the surface will not come as terrible as it would be if nothing was done and then all time have passed and all that. So I have been using it till I'm this age and it has always worked. But sometimes at the back of my mind, I'm just trying to know what the logic of adding salt to injury. Is it really medically advised or not?
It's not.
But it works, and so I'm always running to it.
Okay, you see, that's why I was saying that many times. Don't worry, I'll take the next question. Just let me, before I forget. Now, there are times I say that a whole lot of things that we do actually work. They actually work, but it's not medically proven. It's not healthy. It's not, we are not supposed to do it. We are not supposed to do it. But sometimes behind the scene, we get to do these things. So that's one that I've heard too. But don't forget that we say, don't add salt to injury. So that particular idiomatic expression already tells someone that adding salt to injury is not a walk in the park. As in, how it will be when they add salt to the injury. So that's good, Patience. Thank you. Yes. Over to the other person that wanted to contribute. Who was that?
Abidemi.
Okay, Abidemi. Okay.
Abolari
Abolari.
Yes.
Ahead.
The salt actually works for me too. The salt.
Okay.
I use it severally and it works. Then another one is flour.
Give me my
Can we hold on, Abolari? Hold on, please. Please, let's mute our mics because when we do this, we're going to interfere. Esther. Okay, I think we go ahead, Abolari. Bele, go ahead.
Yeah, I said the salt actually work for me too. I've been using it for a long time and it is working. Then another thing is flour. Immediately you have burn in the kitchen, you apply flour on the surface of the bones. It will go. You will not see water. You will not see it swelling up. It will just dry up here.
Okay,
blisters, yes. There will not be blister. And even pap, the one that they've not the fresh one. When you apply that one too, you will not see any blisters. I've tried those 3 methods and it really works.
Okay, thank you so much for that, Abolari. It's nice to hear your voice. So because sometimes when I look at my list, I'll say, oh, this Abidemi Abolari. I've not heard her voice. So it's nice to hear you. Thank you for that contribution. Yeah.
Thank you.
So many of these things we do them. There's one I wanted to hear. I've not heard it. Many of these things we do them, but take note that medically proven. So if traditionally, yes, we have traditional first aid. That's we don't have to. When you go into first aid training, basic life support, you get there, basic first aid. That's where they'll tell you the traditional first aid and then the modern first aid. They tell you the differences and all that. So in the days of our fathers, we used to have all those things coming on. I saw Nenna. Nenna, did you want to say something? Because I saw your mic. Okay, it's no more there. I thought you were okay. Okay, so do we have any other contribution?
Yes.
Okay. Thank you.
For me, what I normally do is when I have maybe just for my not serious one, I use honey. I use honey to treat.
Yeah. Thank you, sir. Who just responded? I'm trying to look for the mic.
Yes, it's me now. It's me, ID.
Okay. I know. Is it ID that just talked about honey?
No,
No,
chicken and
not ID. Mine is hydraulic.
Okay. I wanted to know who talked about honey so that I would.
chicken and salad, Mr. Chicken and
Okay,
salad.
Mr. Raka. Okay, because I know that's a male voice. When you said it's me, ID, I was a bit confused. Okay, Madam ID, please. It's nice to
Yes,
hear your
ma'am.
voice. I'm happy you are better. Go ahead.
Yes, I thank God.
Okay,
Yes,
thank
sometimes I use hydraulic for that.
Okay, hydraulic. You see, we have a whole lot of things that we can just, let me call it gambling, that we can just, at the spur of the moment, okay, my mother used to do this, or I heard they used to do this, or a neighbor run in and say, oh, you burnt your hand, oh, just get this. Oh, come, let me get this, I've heard a couple of them. That's true. I've also heard a hydraulic. I've also heard honey too. I've heard most of those things.
Hello, good evening. Good evening.
Yes.
What
is it?
Good evening. Please, I want to share my experience too.
Thank you. Please go ahead. I like to hear experiences. It makes me better. Go ahead, please. Share.
Yeah, when I was very, very small. In fact, it was the day I wanted to start a nursery school. One. I had a bones, granite boy. Granite boy bones my leg and granite boy. I was in the kitchen when my auntie was cooking. I asked her to add sugar as a small girl. And when I was telling her that sugar will make
What stops you from listening to this?
very, very sweet. Can you hear me?
Please hold on. Hold on. Madam ID. Madam ID, please, can you help us to mute your mic so that those our beautiful children around will allow us?
Hello, my place is loud. I'm not hearing what you're saying.
Sorry.
That's what
can you hear me?
Please hold on.
Can
Hold on.
You hear me now? Okay.
I am coming, Mabel. Just hold on, please. I was trying to say that it's going to be worse if we are not able to adhere to the simple rule of muting our mics. It's going to be worse when we start the practicals, because when the mics are on, it affects the video quality, and innocent people will suffer for just a few mistakes. So please, I am pleading and craving your indulgence. Today is the last day. Try, please. Just let's mute our mics so we can go. I plead. It's just a humble appeal. Thank you. Mabel. Yes, I think Mabel, you were the one talking, am I right? Please go ahead, Mabel. Yes. Sorry for that interruption.
So I had this bones and it was something else that I had to stay at home for a year. And I think the first thing my mom applied was It's a GV. I don't know. Is it GV? They call it that blue.
Gentian violet. Yeah.
Yes. That was the first thing she applied.
Okay.
It was cool then, anyway. But up till now, at my age, I still had that scar on it. It's still there. The scar is very, very.
That means it was serious. It must have been a serious. Must have been serious from that time up till now. Yeah. So
up till now.
So thank you so much, Mabel. That's something that most of us have had such issue one time or the other, especially women when cooking. Mistakenly, the oil spills on you, or you spill over the oil on your body, or something happens, or boiling water. It's not something you wish your worst enemy. It's not palatable at all. So it's important that we learn, like we just watched that video. Thank God I'm going to put it across. It's important that we learn how to handle these issues when they eventually arise. It's very important. So we have a couple of things, but what I want to tell you is, now, if we cannot say it is proven, all those traditional methods you have mentioned, they have not been medically proven. Yes, agreed, it works. I will not, even before I went into the health sector, I know we used to use, what my mother used to use, she would just use egg, break the egg, and then the egg white. That egg white, the white part of the egg, if she uses it on that place, we find out that it will help. But again, I want us to understand that one thing can work for A and it doesn't work for B because of our skin texture. Because of our skin texture is very, very important for us to know. was saying, these are things that we need to. So yesterday, like I said, we learned a couple of things. In the practicals, we are done with how to treat burns. Today, we are going to look at things that are very important. I still crave your indulgence. I still appeal to you to be please attentive. If you have any questions, you can ask. Be attentive, because after today, like I said, we are going to have the professional examination. I'm not trying to scare you. It's just going to be a very simple, the questions are normally simple that come, to you. They are very simple. One is going to be a CBT test. I'm taking my time to explain before we change over, because maybe after our time may not really take us. It depends on when we finish the practicals. So it's better to say it out, then I can communicate it later on the platform so that you can be well equipped. Now, we are going to have a CBT test. That's a computer-based test. And that computer-based test, normally the way it goes, you are going to have your user ID and your password. At the point I need that information, maybe by next week, Monday or Tuesday, I'm going to reach out to you. You are going to give me your email address, and I think that's all. Your full name and your email address, very important, because your email address is going to, your user ID is going to be coined from your email address, and then you are going to be given your password. Do not be afraid. Any system, you can use your phone. It's highly compatible. That CBT test, you have a phone, it goes. You have an iPad, it goes. You have a laptop, better. So whichever device you have, it's not going to challenge, so long as you have something, an Android form of phone. So it is important for you to note that. So by the time I ask for that email and full names, it's so that I can send it over to BCC and they come up with your username and your ID, your ID that you use to take the professional examinations. Now, it is important also to explain that the professional examination is in 2 phases. 2. The first phase is the multi-choice. That's the one you are going to have CBT. Is the multi-choice questions. And the multi-choice questions is something you just answered. You'll be given a specific time. You log in, you answer your questions, and then you submit. And once you answer your questions, at the end of you answering your questions, the system automatically takes your score. There's nothing you can, how do I put it? Automatically takes your score. Because there are situations we have people entering twice. That's what I mean by twice is they may attempt to, maybe they have hitches at the end, and they see their score, because of course you see your score. You see it there. You see it. If you have 5%, it will show you. If you have 100%, it will show you. Whatever your score is at that moment for the multi-choice, it will show you there. So in an attempt for you to want to log in again, 2 things. It may not admit you for the second time, or it may admit you, but the system had already taken your first score. So these are some of the 1 or 2 things that I just need to let you know. Then the part B, that's for the part A. So when you submit your score, automatically that has been taken. Then the part B is this. From all the skills that you have learned, please, are we together? Can everyone hear me? Because I don't like talking to myself. So I'm sure that we are all on the same page. At least the people that are here, the others will only get to see it on the platform. So what was I saying? Okay, so you would have to pick any skills, because it's not our intention to make anyone fail. Like I told you, any score less than 350 over 500, you'll be advised to retake the exams again. Because we cannot, like I told you, when you eventually get a job or they need us to refer, they need some form of attestation from us. So we have to be sure of the people that we are actually sending out to work anywhere for any reason in the course of this health setting. So they get back to us. So if you have less than 350 or 500, you would be advised to retake the exams. You will not be certified, because we cannot certify you until you take the exams and actually hit a mark of at least 350 over 500, which is fair enough. So, but nobody, so far so good. Thank God, and God has been faithful that our participants, they've not fallen short in that aspect. We've not had, I think just once we had someone that retook the exam since we started counting 4 years now. You understand? So we trust that nobody would face that challenge. Then we are going to pick a skill. I don't want to say carry out CPR. No, I don't want to say carry out hand washing. There are many skills that we have learned, that we learned yesterday and we still learn today. We have the hand washing, we have the donning and doffing of gloves, we have the placing a casualty or a patient in recovery position, what was done yesterday. And we had a couple of things. So any of the skills we had that you learned, please, you are going to need to, addressing a client with affected arm, we'll look at what you do, the weak arm, we'll look at what you do, the strong arm, and all those skills is just to test you. So you are going to pick any skill that is convenient for you. And then you make a short video, a video of not more than, doesn't exceed at most, maybe 5 to 8 minutes. It could be less. We are not actually looking at the duration of the video. We are looking at the skills. We are looking at some strategic aspect. That's what they normally look at. So they'll see maybe hand washing to see if you actually, the way you wash the hand, did you just rub the soap? Did you close the tap with your hand after washing your hand? Did you use and a couple of things. Some things are actually looked into. So, or how to reposition a patient, which we are going to learn today, how to reposition or how to convey a patient from the bed to the wheelchair. We are going to see those ones today eventually. So if you at any point have any questions, please do not hesitate to reach out to me on the platform. Like, you know, I'm always there. So you just pick any of the skills that you find most comfortable. I advise people, don't want to go and do the one that is, that you know you are going to make mistakes. You are not well grounded in it. Do the one that you know that you can do it, that when they sit there at BCC, they assess the video, they know that, yes, you did this at this point, you're supposed to do it. Okay, you did it. What about this? Did you do this at this point? Just 2 of them gets you that mark. So that particular mark is added to your multi-choice question score, which is the CBT test, and added together to calculated to give you a score over 500. That is to say, like I told you, part A, part B put together should give 500 marks. So I think I just needed to explain that to us. Please, where is officer? We'll soon start. So I don't know if there's any question as regards that, while we put our resources together and kickstart the first aid, second batch of first aid. Yes, please. Please ask your question. I'm listening. I'm all ears. Please ask your question.
Good evening. Please,
Good evening.
I want to repeat again that this video you just mentioned. This short.
Hello, good evening. Please, I was attending to. Let's hear who is talking.
Mabel is.
Okay, Mabel. How could I forget that voice? Go ahead, Mabel. Yes.
For this video, this short just played.
Yes, I'm hearing you. You said this short video I just played, yes?
Yeah, if you can replay it.
Okay, you mean if I should replay it? You want me to replay it? Okay. Even though it will eventually get to you, but let me replay it, because maybe I think you are one person that has complained of a problem. I don't know. I don't know, but don't worry. You know, I don't leave people like that. I am going to, it's just that I have been busy that yesterday trying to put up things together. After today's training, I will ensure that I get to the bottom of that challenge that you're talking about. It would mean me maybe coming to get the video and breaking it down into smaller bits. I don't know. I'm still thinking. I'll discuss with my ICT guy, and then we'll see how best to help you. Never mind. By tomorrow latest, we should get that sorted out. So
thank you so much.
Well, let's see. The video is actually short, so let's see. I like to satisfy everybody, so now I think we have a higher number. So let's get back to the video. It's very short. Let's get back to it and see what to do.
Have you ever spent too much time out in the sun and
Please, is it audible? Can you hear?
It is, ma.
Yes.
Okay.
Forgot to apply sunblock. Scalded your arm after touching a hot pan or spilled coffee on yourself accidentally. The severity of burns are categorized into first, second, and third degrees. For minor burns, which is first or second lower degree, this is treatable at home, while others have to be treated in a medical facility. Directly after receiving a burn, place the affected area under cool water for 10 to 15 minutes or until the pain eases. This is to stop the burn from spreading to the surrounding area. Remove items such as rings or tight jewelry from the affected area. Do this before the swelling starts. Apply a thin layer of aloe vera lotion on the burnt area to help soothe the pain and promote healing. Make sure the affected area is kept clean and dry to prevent infection. If the burn has an open wound, clean and dress the wound like how you would for a small cut or abrasion. Do not apply butter or ice on the wound, as it might set the affected area up for frostbites or infections. This video is a guide for basic first aid. If you are unsure about what to do, visit your nearest medical facility immediately.
Alright, so maybe was that fair enough?
Very well, ma.
Okay, so practically, like we said, first aid is first treatments given. So there are levels of burns that you cannot handle. We have the first degree burns, we have the second, and we have the third. So when it gets to like maybe fire engulfs a place and that turns disastrous, you cannot go and practice your first aid there because but for little burns, first degree burns is something you can just put under running water. You see, nobody talked about use this, use salt, use that. Those ones are actually traditional methods, and it works for the people that believe. I believe that anything you believe in will work for you. You have strong faith in works for you, but medically it's not been proven. So at this point, let's see how to get down to what we have for today. Network hasn't been favorable from my end. I didn't watch the video. Oh wow. Mr. Kingsley, because I didn't see your name, and I was wondering why, because you are always about the first or second. Hello, Mr. Kingsley, are you here with us?
It's not Kingsley. My name is Kennedy.
Oh, sorry.
I'm using my other device today.
Okay.
Yes.
Okay, Mr. Kennedy. See, I don't know if it is old age, but I keep mixing up names. I actually have a Kingsley on the other platform of the other training, caregiving. So I think I just mixed it up. I'm sorry, Mr. Kennedy. It's nice to have you on this platform. I've seen that you say you couldn't watch the video. Is it still the same issue right now? You were not able to see this time around also? Hello, Mr. Mr. Kennedy. Mr. Kennedy. Okay, I think network is okay. Mr. Kennedy, were you able to watch it? Yes, were you able to watch it this time around that we played it this last time?
Yeah, I watched it, but I think it was very short.
Yes, it's a very short one.
From my own side.
It's a very short one. It's very short because of the weight of the videos. I don't want to put you people through all those long videos again. It was very short. So thank God we were able to watch it. So let's quickly go there. Then I have, because I'm checking, please pardon me. I have someone, I like to check the group. Esther Madu. Mrs. Oliver, have you been able to join us? Because you are saying you can't log in. I don't know why, because every other person.
Yes, I've joined.
Okay, I just saw it now. Sorry. I don't get to check since I'm still the one talking all the time. All right, so let's move to the first aid part of it. Like I said, we are going to be looking at a continuation of the first aid, and we'll be looking at manual movement, handling of a patient. Like in first aid, like I told you, I also belong to the International Red Cross. So sometimes we have to look at it in the Red Cross aspect as well, the way they do it, which is first aid. So we are going to look at how in a place whereby you are not you are in a village, or as a first aider, you have to improvise. Anywhere you find yourself, you have to make very good use of that particular setting. So you improvise, you just get what you see and ensure that as much as possible, you alleviate your patients, your casualties suffering. We call casualty in first aid. So at this point, like we did yesterday, we are going to hand over. I told you I work with people. I work with Officer Wilson. I work with Queenship, Nurse Queenship, and our beautiful first aider, Mary, and a couple of other people. The media guy, Uncle Progress, that has always been handy. You know, ICT guy, and my beautiful little daughter, Edidion. So we work with all those people. So over to you, officer. I think the floor is open for you. Let's get to work. Please, let's.
Good evening, all.
Good evening,
Good
sir.
evening. Good evening, sir.
Good to see you again today.
Yeah.
Good evening, sir.
With you today.
Can I open it?
Yes.
Today we are here again to look at how way, the primitive way, and all of you have rightly said some primitive way of handling different.
Sir, your voice is cracking. Oh, can't hear you very well. Your voice is cracking.
Mute there.
Can you hear me now?
No, that audio.
Hello, can you hear me now?
It's still cracking.
We can hear you, but your voice is cracking.
Your voice
sir.
is cracking. Your voice is cracking. We can hear you, but just that it's cracking.
Okay. Sorry about that. All right. Is the voice stable now? Is it okay now?
Yes, it's okay.
Yes, the voice is okay.
All right. Thank you. So as I was saying, that was the first thing we have for today, and you've watched the video and seen using aloe vera gel to handle burns, and I have overheard you talk about the primitive way of handling burns and other ailments. This primitive way do work. They work. Some of them work instantly, you know, but for the fear of some people about hygiene and all that makes people not to really delve into it, but they really work. Like I was saying, in the case of infantile convulsion, in our primitive way, as a little child, you remember what your grandparents normally do in your different locality. So that is just it for the burns. But I want to add something for the burns. The white part of the egg can form the gel that can take care of burns. And I want to let you to know that burns, treating burns have to do with the class or type of burns that is involved. You know, if like the first degree burn that only take the first layer of your body, like the first degree burns. In that first degree burns, only the first layer, the outer layer of the body is affected. Then if you now get to the second degree burn, the two layers are involved. And in second-degree burns, you always experience blisters. You know, you have blisters. So the use of things like gentian violet, that aloe vera gel, they do take care of that. But remember too, no matter what you do on the burns or whatever you do in first aid ends, your first aid ends when you hand over the casualty to a medical facility or a doctor or suffice it to say. So, and you will have to use something to cover the burns. Okay, you cover it too. Why? So that the surface of the burns will not be contaminated by some microorganisms. So with that, we want to get into some other thing now. We want to get to some other thing. Manual handling and movement of a casualty. You know, when things happen, at the end of the day, you have to convey the casualty either to the ambulance, whatever facility you want to take the person to, or you may assist the casualty that cannot walk to walk. For instance, if someone have a sprained ankle or dislocation or broken bone, have problem with the leg and cannot walk, there are some ways of handling that. Where is this guy? Where is the ball? So I'm going to show you, the first thing I want to show you now is how to do a one-man assist. Let's go. Okay, this is Mary. And assuming that she has a dislocated ankle and she cannot walk with that leg, what I will do is I will get her off the bed. This is the affected leg. She cannot walk with this leg. The leg is not functioning well, but I'm going to assist her now to walk. I will now put this her leg on my own and help her to move. Okay. All right. Please go back. Come back. Still with a one-man assist, it may happen that she can walk, and I still need to assist her to walk, maybe faster or walk well. What I have just shown you is in a situation whereby she cannot use this other leg at all. You now put it on top of your leg, the affected leg, and you will help her to move. But if she can walk, you can still take this, still help her to move. That is for a one-man assist. Let's go back. Now, I'm going to show you another thing, and the second one, which is two-man assist. Why two-man assist? There is what an acronym we call TILE when it comes to casualty movement and handling. If you spell that TILE, T-I-L-E, in a vertical order, the T there stands for task. The I is the individual involved. Then the L there is the load. Then the E is environment or evacuate. So when you want to apply that, this is a casualty that I need to carry.
I didn't hear you. Please, can you come again? Sorry, sir. What you just said now, sorry, sir.
Okay. I was saying in casualty handling and movement, there's the principle you have to take into consideration. The principle of tile. If you spell the tile, T-I-L-E, in a vertical order, the T stands for the task. And what is this, the task that must be done here? Conveying the casualty from one place to another. Now consider the individual. How is the individual? The next thing you know, is the individual fat, or does he have a moderate body? That will now bring this other question. Can you be able to carry her alone? Or you will need assistance, because the individual involved will now help you to know the load, how to handle the load that you have to carry. Remember, it is a load. So in some cases where you know that you cannot carry this lady, now the load determines the system of carriage and movement of the casualty. Are we together? Now, I am going to show you how we can do two-man assist to carry a casualty that is above my carrying capacity. If I have a casualty that is small, I can use any system to carry it. But if the casualty is above me, I will call for help. Please come. Or Andy can come. Come.
Sorry, sir, what did you say the E is? The acronym of the E.
The E is environment, or
right,
evacuate, or evacuate. Now, we want to help this man, we want to carry this man. Okay? This is two-man assist. No, this one. Just hold me. Go on. Okay. We want to carry him. The two of us, we go down, sit. Okay. Up. Okay. That is a two-man carriage. Now, there is this other one too. We can do. Oh, man. Okay, sorry. Okay, just sit. Up. This is always done by two people. Now,
please, I didn't see the hand, the position of the hand.
Can you see it? That forms a stool that the casualty can comfortably sit and we carry. Now, in the same vein, you lie down.
Bring your hand.
Sorry, sir, I didn't see it. Sir, we are not seeing it though.
Hand. Hello. Can you see the hand now, how we do it? Come and sit. And they can stand up, come and sit.
No, I think it's the question.
How to make the hand. You hold each other's Can you see it? Let someone
Yes, sir.
respond now.
Yes, sir.
Okay. Then when you go down, the casualty will sit and you move the casualty. Please go down. We can also make use of the stretcher. Okay. This is how to make the stretcher, and you raise it up. Under here, there is this hook, and you have to press it up to make the stretcher. Okay. And now turn it. Okay. The stretcher have an handle that you hold to move. This is the handle. You draw the handle out.
Sorry, excuse me, the stretcher.
So
It went off from my end. But I don't know, I didn't see how you stretched it.
sorry.
The stretcher, how were you open it? The stretcher was open. I think maybe.
Okay. Please watch out again. We are going to fold the stretcher and open it again. For folding, we press in the handle. Now turn the stretcher. Now under here, there is a pin that you have to press. Okay, good. Have you seen that? Now, right here, there are two hooks that when you press the hook, please raise it up. Then you fold the stretcher. Yes, when it is not used, this is the position the stretcher should be. Now, we want to make the stretcher now. Hold it. There's something that I've blocked. Okay. It's yes. So we have to make it. Okay, good. Press it down. Okay. Why? Okay. Now you come here and press it forward. Then your stretcher is ready. Remember to remove the handle. Okay. Now we want to load this casualty on this stretcher. Now, I will put the casualty in the lateral position. and the stretcher is brought and put down, I will now push the casualty gently on the stretcher. Then you draw him up, raise him up. Okay. Remember to fasten the belt. This belt here is to stabilize the casualty on the stretcher. Put it on there. Eso es muriendo. Okay. Now we are ready to carry. Position, take. 1, 2, lift. As you can see, you make sure both of you lift the stretcher at the same time. Then you are ready to move. All right.
Thank you. Thank you. Thank you.
Okay.
Oh, thank you.
Any question about that?
Please, do we have any questions? Let's ask. Concerning that, like we talked about manual handling of a casualty. Sometimes you may not have the stretcher. There are other things you can use, which we are going to get to here. And this stretcher, we have several, we have so many. So do not bother. You may have the one that is very simple to handle. The one that is very simple to handle.
Press now.
You won't pass through all these protocols of opening of the hair. We just have it there. It's just folding and unfolding, very easy. So stretchers are different. You may not have this one that it's a bit difficult to handle. So we have the other one that is just with the iron and just with the cloth. So it's easy to handle that way. So please, do we have any questions? I don't even know if I'm talking to myself. Can we hear? Can everyone hear?
Mom, we can hear you, ma.
Yes, ma. But I need the remaining acronyms. I-L. I and L.
T-I-L-E. TILE. T-I-L-E. TILE.
This
is the acronym. T is for?
What does the I stand
for? T is for task.
Task.
The task that you have to do is the task of conveying the casualty from one place to another. T.
I.
Okay, the I.
Officer, explain.
The I stands for individual. Who are you carrying? How is the person? Would you be able to carry the person alone? Okay. Would you want to call someone to help you to carry the person?
Depending on the weight, yeah.
Okay, so that is the individual.
Okay, then the L.
The L is the load. Like for instance, when we brought the casualty, the stretcher, and made the stretcher ready, you know, the casualty there, the load we have to carry has made us to use the stretcher. If not, maybe we would have done 2-man assist or fireman carriage or whatever other carry, but this warranted us to use the stretcher. And that was why we brought the stretcher to load the casualty. That individual is the load that we put on the stretcher. Okay? Then the E has to do with the environment. How safe is the environment? Okay. And evacuating too.
Okay.
And evacuation. How safe is the environment before you evacuate? Evacuate means you carry the casualty away from the scene of the incident.
Okay.
Any other question or clarity that we need?
All right. Thank you, sir.
All right, man.
Yeah. Good evening. Good evening.
Yes, I'm with
I
you.
have a question. I don't know if you can hear me, even because me, I can't hear myself clearly.
Please ask.
Okay. This casualty handling and movement.
Yes.
She talked about examination when we're going to write our exam, but it's very practical. So are
Please
you
come
saying
again.
that the exam, when we're going to write our exam, is going to come in 2 ways, the practical exam. So this fresher that you're talking about, if we want to do this practical handling and I take this particular one that you just, must I have a stretcher to do it on my own, or I can use any other form of
You can use any
so
other
my
form,
question very well.
any way you can carry. There is what we call,
Okay, it must not,
there's what we call
it must
blanket
not be a
carry.
stretcher.
Hello, ma'am.
Okay.
Are you with me?
Okay, I'm with you. Yes,
Okay.
sir.
Now, what if what you want, the person you want to carry does not warrant stretcher? Okay. Or does not even warrant you to look for assist you. It might be if it's a little person that you can carry alone. Okay. You can carry the person. Okay. The normal way of carrying a child. You can carry. There is this other one. Please, Anita, please come. Please come. Please come. Come. It might look funny. It might look funny, but if I want to carry this guy alone, and I know that I can carry him, he is in my carrying capacity. I can carry him this way. Can you see that?
Yes, sir.
So there are so many ways you can help carry the casualty. It does not necessarily mean until it is stretcher, you know.
Okay.
Thank you, officer. I think I understand. Please, let's mute our mics. Someone's mic is on. That's why it's echoing sound. Let's mute our mics. Let's help ourselves. So as I was saying, there are many ways you can handle. When we are doing the practicals, I repeat, because I'm taking time to explain. Any of the skills, be it the first aid skill, the CPR, whichever skill that you have learned, hand washing, doffing, donning of gloves, manual handling of casualty, using the towel, whatever you have to do. It doesn't have to be like in this case, you don't have to use a stretcher because I wouldn't want, I don't think they over their BCC will expect everyone to own stretcher. So if you are actually picking that particular one, you can use, but take note, please, let's note, just as Officer Wilson has said, it depends on the particular challenge that the casualty has. If a person that has spinal cord injury, a person that has, different maybe stroke, that has one part of the body there, it depends on the particular illness that the patient has, that you know which particular method would be best suitable for you to carry that person in a time where there is an emergency. Take note of that. If you can use, there are times we even use the blanket. Am I correct, officer?
Yeah.
You use the blanket to carry. Just this one holds the two ends, this one holds the two ends, and you move. But you cannot use a blanket to carry to convey a person that has spinal cord injury. Take note, because it's going to shift the bones, and the bones will be rubbing on each other, and it will do that person more harm than good. So when we are practicing these manual methods, even in our practicals, we should be able to know which one aligns with which illness is most appropriate for me to use a stretcher, which one as we get to here. Someone that has sprain, if it is sprain, you need to use a board. If something had a hard surface that will give that person, that will be steady, that will not be shaking when the person is moving. So these are some of the things that we have to understand when we are carrying this out. So you don't need to have a stretcher in any of the methods you find suitable. What I believe they will actually look out for is the hand coordination. If you are doing the two-man assist, you are doing everything, look at the proper way to do it and the proper hand coordination. Thank you. I think that should be fine. Do we have any other question, please? today we wouldn't really like to exceed 8 o'clock. And we want to have everything done judiciously. So I think we can go ahead. Nena Chinwe. Hello, Nena, can you hear us?
I can hear you. I can hear
Okay.
you now.
But I'm seeing can't hear anything. So I don't know, maybe I'm just seeing it now. I need to carry
Oh.
everyone. Thank you. Thank you. So let's go
I can
ahead.
hear you now. I can hear you now.
All right.
All right. Welcome back. The next thing I want to share with us is what we call triage. Triage. I think maybe you must have heard it when you were doing your theoretical part of the first aid training, but I really have to let you know about triage. Triage is a coinage in French language that means to sort, to select, to arrange. Okay. Now, it is the process of quickly getting casualty in a multiple casualty incident, assigning priority for receiving treatment according to the severity of their injury. And there is, I told you, everything in first aid has principles, and you have to follow these principles. And those principles are not to be compromised. These are the things that will help you to do your diagnosis. Meanwhile, I'll talk about diagnosis finally. Now, in a multiple casualty incident, there are some conditions that are more critical than others. For instance, okay, let me throw this as a question to us. If something just happens now, and you come and meet like this casualty we have on ground now, lying, no, it was not this, only this one, but we have up to 4 of them. Sometimes one is lying mute like this, he's not talking.
There's another one shouting his leg, and you can visibly see a fracture on the leg. And there's another one that exhaust pipe from a motorbike have burnt the leg, and you can see the bones. You see the broken bone, and you visibly to see the other one bleeding seriously. And this other one lying like that, you don't even know what is happening to him, just dumbfounded. Which one will you treat first? I'm just doing this to us. Let's just have this class. Let's contribute. Who will you treat first? Someone with a broken bone, someone bleeding, and someone that is not talking at all, and someone with burns.
Someone that is not talking at all.
Someone that is not talking at all.
Someone that
I
is
think
bleeding.
I'll go with the one that is not talking at all, because maybe the person own is severe. I'll check first if he or she still breathing.
Okay, thank you so much. Thank you so much. I love that, because in some classes that I take, most people go for bleeding. Why? Because bleeding, they visibly see the person is bleeding, people fear blood, but the answer you guys are given is correct. That is very, very correct. Why? Because you don't know the why this person is not talking. So there is a principle for it, the principle of the 4 B's. If you put the B's in a vertical order, B, 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 the 4 B's. The first B there is for breathing problem. The second one is for bleeding. Then the third one is for burns, while the last is the bone. This is how that is severe they are in that order. Now, if you meet a casualty like this that is not talking, that is not is dumbfounded, that now leads us to call blueprint. Okay, I hope we understand triage. Hello? Hello, I hope we are okay with the triage.
No, sir.
Okay, we are
No,
not okay.
please
What,
explain
do you have
that.
any question about triage?
About
Triage
what?
is
It's not what you're saying. Is not.
Okay.
I tell us that triage is a process of quickly assessing casualties in a multiple casualty incident, assigning priority for treatment according to severity of their injury. Someone that have a breathing problem is more critical than someone that have bleeding problem. Then someone that have bleeding problem, the condition is more critical than the one that have burns. Then someone that have burns is more critical than someone with bone. In bone there, bone does not have any.
Tutu. You happy?
So people are talking.
This is serious. This is serious.
People are
Honestly,
talking from the background.
this is serious. And the next thing they'll say, I cannot see. The only problem is
And they are busy, they are chatting.
Okay, because you are allowed. There is no problem. We would know the chatters and the people that are not chatting. When it is, even if you
less stressing that people cannot really just adhere to. Please, officer, just a minute, please. I think, can everybody hear me? I just want to talk about what the officer is doing right now, just briefly.
Yes, I can hear you.
Because you know the reason I
Yes,
said I
ma,
want
I
to talk
can
about
hear
it
you.
is
Charity can hear you.
okay. In an exam situation, like I said, you will be expected to do any of them. So what he's saying is there's something they call triage. T-R-I-A-G-E. Try and age. Triage. That's it's coined from a French. It's a French. It's coined from some French.
It again. Please.
T-R-I.
I can't hear you. I can't
It's
hear you.
breaking,
We did
ma.
not hear you.
It's breaking, ma.
Day, oh, please let's just coordinate ourselves. Today is the last day. Some people are just busy chatting from the background. I
don't know if it's still breaking. Can everybody hear me?
Yes, I can hear you now.
Yes, ma.
What I was saying is that T-R-I-A-G-E. That is triage. It is a term that is coined from words. They put it together to form that triage. What does it?
We did not get your last. You did not get the last letter spelling. Maybe you tell us B for ball or something like that.
Okay, T for Tom, R for rice, I for ink, A for apple, G for girl, and E for egg. So that is triage. Don't worry. Even if you don't hear it properly, I will still drop it. You know, I always give it the slides of it. So just to process what we are talking about. But that's what triage is. So in an accident situation, on a fine day at the first aid, maybe you run into an accident situation, or maybe a war situation where you have many casualties, people wounded, people lying anyhow. That's how Red Cross actually came into it. So it will be difficult for you if you don't have the knowledge of triage, because you wouldn't assist them based on the fact that some are family members or some are my friends. No, partiality is out of it. They are not partial. So you have to follow triage. You look at the severity of the challenge that they have. What is the problem? Those bleeding, we talked about the beads. For bleeding, those that have bleeding, those that have maybe breathing problem, they cannot breathe. You understand? And people that have that BBBB, following that order. So you have to look at the severity, which one comes first, which the question was thrown, that the most important one is the person that is not breathing, the person that is unconscious. Because that one, you have to do some assessment. You cannot really play. That person is struggling more, holding more to the tighter, tightly to the thread of life, more than the others. For bones, it's not in order of severity, it's not very serious because yes, treat it. Other more pressing issues are more important. That is where triage comes into the picture. It's a terminology that is used to address situations where you see multiple casualties with different challenges, injuries. So you order them in use scale of preference or opportunity cost. I don't know how to, you order them in the most important.
Is it triage?
Yes, that's the triage. So you order it.
Is it an acronym?
Triage is not an acronym. I said it is a coinage in French language that means to sort. It means to select. That is, as in, when we say triage, that is, we say, okay, you are selecting. For instance, I said
selecting based on maybe the 4 Bs.
Yes, 4 people are down, and you have now to start treating them. What you do, you select those that have that their condition is severe than the others and treat first. For instance, the first B is for breathing. Maybe someone is having heart attack, or anybody that is going unconscious has a breathing problem. Then the next one is bleeding. The second one is bleeding, the second B. Can we go on?
Yes,
the second one. Okay, the second one is bleeding. If somebody is bleeding profusely and is so severe, it may lead to shock. Severe blood loss leads to shock. Why? Because oxygenated blood flow to the brain will have deficiency. There will be not enough oxygen. Remember, the brain, the food of the brain is blood. Okay, so now, like I was saying, this now will lead us to, I am now taking this man that is not talking, that is not breathing, that is not giving me concern for the severity of his condition. And that takes us to what we call blueprints. I think I talked about blueprints yesterday, and I talked about the principle of AVPU. That is the A is for alertness, the V is for voice, P for pains, and the last one, the U, is unresponsiveness. So, like I said yesterday, for blueprints means the head-to-toe assessment of the casualty, the head-to-toe check of the casualty, the head-to-toe examination of the casualty. How do you go about this? If you call this casualty, hello, how are you? If he is conscious and alert, he will respond. Let him hear. Hello, how are you? Okay, are you okay? Yes. Okay. Where do you have the pain? Where do you have the ailment? Okay, your waist. So let's see that. He is responding. He is alert. He can now tell you, he's telling me the waist. Okay. But in a situation whereby he cannot talk, and right now his eye is open, to check alertness again, I will do as if I want to put my hand in his eye, he will blink the eye. That means he is alert. But if you do that and the eye is still open, okay, you now know that this man is unconscious, because someone can be unconscious, but the eye is still open. Okay? Another thing too, if you see somebody like that, that the eye is open, but does not respond to external stimulus, okay? That can indicate head injury when this man is not talking to you at all, or spinal injury. These are indications. Okay, very soon I will talk about signs too. Now, you arrange the casualty for blueprint. You now start to massage the body from head to toe. Don't fail to open the mouth and check if there is foreign object in the mouth, because if there's any foreign object in the mouth, if it falls to the tongue, it will block the airways, and that is the cause of unconsciousness. You also check the ear, can check the ear, then you gently massage the body to check where there is ailment in this man's body. Now, as you are massaging and going down, when you touch where he has problem or pain, he will squeeze or squint his face. That is when you stay there to diagnose. Okay. Are we together?
Yes, sir.
Okay, ma. Now, you have to apply that AVPU. A for alertness, U for A for alertness, V for voice, P for pains, and U for unresponsiveness. And unresponsiveness there means that this person is unconscious. Then you have to do something.
Please, sir, can you repeat the acronym again? Please, can you repeat the acronym again? Sorry, sir. Thank you.
The acronym is AVPU. A is for alertness. V is for voice. P is for pain, while U is for unresponsiveness. If he is alert, he will be able to tell you what is happening to him. And when he tells you what is happening to him, that means that takes care of the voice. Now, we want to quickly also check from the blueprint there. We want to quickly talk about diagnosis. Diagnosis there is knowing the history, the signs, and the symptoms of the incident. Sometimes, on approaching this casualty, I see an alcohol can. I will quickly know that he has taken alcohol. Sometimes you can see skid marks on the road or a knife. You quickly know that, okay, this is what has caused the wound on him. All those ones are called signs. Then symptoms here have to do with the sometimes if someone is sneezing, okay, is sneezing, you know that can be a sign, a symptom of something. Or if you touch someone with the back of your hand and you now feel heat on the body, it's a symptom of something. Okay, so that makes diagnosis. Then another thing I want us to look at is the bandage. There's what we call a triangular bandage. Here it is. It is always like an head tie. Triangular bandage. And this triangular bandage is called the first aid companion. Some people call it the first aider companion. Why is he your companion as a first aider? Because with this bandage, you can get other types of bandage from it. You can use it to do anything. This can be used as scarf. You can use it as scarf. You can see that. Now, if I bring the apex of the triangular bandage to the base, it gives me what we call a broad fold bandage. And this broad fold bandage can be used as girdle. Okay, so we know what girdle is. Can be used as girdle. Now, yet still, if I still bring the apex again to the base, it still gives me a broad fold bandage, but this time not as big as the one that we use for girdle. And this one can be used to immobilize head injury. Okay. Now, yet still, I can still bring the apex again. And it now gives me a narrow fold bandage. This narrow fold bandage can take care of my risk or whatever thing I want to do. What am I trying to say? We derive these other bandages from the triangular bandage. All right. Just 1 minute.
Can you hear me?
Hello, can you hear me?
Yes,
Hello?
I can hear you. Yeah, we can hear you.
Yes, we can hear you.
They cannot.
We can hear you.
Okay.
We can hear you. We only can see. Okay, we can see you now.
Okay.
So, because like I said, we have a lot to do today. So we practically talked about first aid. What we just saw him do right now was to show you how we can use, as a first aider, you improvise like I have been saying. So anything can happen anywhere, anytime. Even if you don't have a bandage for women, you know that triangular bandage is just like the head scarf, the scarf that we just tie on our head. If you want to go out the way it is, it's a triangular form. So it you can use it, make it broad, you pick the apex, fold it, make it narrow. In case there's someone with head injury, nothing immediately you need to do to arrest that situation. You don't have to look left, look right. Of course, it is a first aider's best friend. That's why we are told that the first aider you should not do without having a triangular bandage. You may not have the other ones because we have so many bandages. But that triangular one will help you do anything you want to do. Someone has head injury, you can take your scarf, pull the apex, form the shape you need, and then help to press to arrest the blood. Like that. It is very important. In fact, like I said, every first aider should have a first aid box in your house. No matter how they are different sizes, so it doesn't have to be an expensive one. It could be the small one. So we can just use that small one, and then you have the major things you need there. Maybe someone cuts the hand, maybe there's just a little emergency around, just get hold of the first aid box. Like we have the big one there that you have seen officer pull out a lot of things, so many things inside that you need. So for now, we wouldn't want to go too much into that. We have exhausted what we have to do, the first aid or under the first aid aspect of it. Now we want to look at the remaining skills that we need to learn as certified nurse assistant. Yesterday we learned that today we are going to continue from there. If you need more in-depth knowledge, because we cannot delve deeply into it because it's not a basic life support training, it's not a CPR training. You need to have the total beginning to the end, explore the fish shape. It's always called fish shape fainting, how to do, although someone has cardiac arrest and so on. Fish shape is the acronym. So that one is really for a basic life support training or for a CPR training. So at this point, I think our nurse right here, we are going to just take it up from there and see what to do. Yesterday, I guess we learned a couple of things.
Please, we can't hear you.
We can't hear you. Can't hear you, ma.
We can't hear you, ma.
While we wait, I think you were saying you couldn't hear. All right, AVPU. Thank you, Martha. Thank you for that, for putting that there. So we are just going to see the next part of it. But before we continue, while we wait to tidy up what we need to tidy up, I don't know, were we able to get that acronym, the AVPU? I can see that Martha has
Yes.
placed it here. Thank you, Martha. So you would be a very good secretary, Martha, you for helping us out. So fine. So that's AVPU. What all the acronyms, you are going to get them. You would get to see it. Do not worry. Even though we are not having a basic life support training, but I had taken my time to ensure that we have to learn all those skills so far. So do we have anything? Do we have anything that we may wish to ask? We are going to see now, the first thing we are going to see is how to make a bed. You know, there are certain skills that are very, very peculiar to certified nurse assistants. Good. So, okay, thank you, Abolari Abidemi. Thank you for that A, for telling us the A. Good. People are really at work on this platform, The Voice. Okay, thank you. So we are going to see how you can lay a bed, how you can make a bed, because that's one of our primary duties as CNA. We are going to see how to make an occupied bed and an unoccupied bed.
Responsiveness.
Kí ló ń ṣẹlẹ̀? Má dún rest on mi jọ. Mo kò ní wait.
Yes.
Yeah, Michael, somebody is talking, please.
All right, good evening. I am your regular Nurse Winship John. We are going to be starting with bed making. We will have an unoccupied bed making and an occupied bed making. Bed making is just a simple way of arranging the bed clothing in a way that it will promote comfort to the residents. So an unoccupied bed is that bed that you made when nobody is inside, while occupied bed, in the other hand, is that bed that you made when the resident is already on the bed. So now I am going to start with making an unoccupied bed. So first of all, can we hear me?
Very well.
Very well,
Yes,
thank you. So we are going to start with—
Yes, I can hear you.
Okay, so we are going to start with an unoccupied bed, also called an open bed. So first of all, I have to gather my supplies. Here are my supplies. I have the draw sheet, I have the under sheet, and the upper sheet. They are all here. So as part of infection prevention and control in the home care, I am going to start by washing my hands. Here I am. Hope we learned the proper way of hand washing yesterday. Hello?
Yes, ma.
Yes.
We learned
this again. Hello?
No, ma. No.
All right.
Network was
Thank
very
you.
bad.
Okay.
Ma, did you use soap?
I use soap. I use soap. Now I'm going to be wearing my gloves. You can decide to use glove and you can decide also not to use glove. For the bed making, yes. Oh, glove.
So, do you have to wash your hand, wear the gloves after washing your hands?
Yes. The most important thing is hand washing. You can decide to wear gloves, and you can also decide not to wear. But today I want to be wearing my glove. Yes. It's on. All right. Think I'm done wearing my glove. And my bed, as you can see, has been stripped to the mattress. Before you do bed making, for an open bed, the bed has to be stripped to the mattress. So my bed is stripped to the mattress. And you have to arrange the beddings in order of their use. So I'm going to be starting with the bottom sheet. This is my bottom sheet. Here I go. Please, you don't fling the bed sheet all over. Put it on the bed. Gradually, you open it. Remember that bed making is a 2 nurses procedure. But where you are found alone, you can also make the bed.
What did you call this one? Bed cover?
I'm using this as my bottom sheet. Yes.
Bottom sheet.
Yes. Bottom. That's the first sheet. The bed is the bottom sheet. Yes. Now, I am going to be folding in the excess part. And how do you fold in the excess part? You must fold in the excess part in a way that there will be an envelope corner at both ends of the bed. Here I go. Can you see me?
Yes, I can see you.
No,
All right.
I can't see.
We can see.
As long as people are not muted. When you are not muted.
Can we see now?
We can see you. I can see you. Okay, I can see you now.
You can see me now. You can see my
we
bed.
can't see you again. Can't see you again.
This is
I
my
can't
bed.
see you.
Just mute now. When you mute.
It's going off and on.
If you mute your mic, can everybody hear me?
We can see you.
You can see me.
Yeah, we can see you.
Yes.
Okay, I can
now.
continue. Can I continue?
Yes,
ma'am.
Please.
Yes,
All
ma'am.
right. All right. So here I go.
See you again. No, I cannot see you again.
You cannot see me again.
Because Chukunonso's phone is not muted. You people should mute and allow us to pass this level.
We can't see her now. Not...
What should we do? Okay. Now you take a part of the sheet, put on top of the bed. Have you seen what I did?
Yes.
Now you tuck in part of it. Bring this down. Tuck it in. I am done making one side of the bed. Then I'll go down. Are we together?
Yes, ma'am.
Lift the mattress.
Yes, ma'am.
Hello?
Yes, ma'am.
Okay. Lift the mattress. Pull in the sheet. and take a part of it at an angle of about 45 degrees. Fold in the excess part. Bring this down to make the envelope corner. And then you tuck in the remaining. All right. Like I said, it's a 2 nurses procedure. If we were to be 2, while I was talking in the other side, students would have been talking in this other side. But because I don't have an assistant and I have to do bed making, I have to try and do it. Always start from top to bottom. Here I am again, taking part of it, folding in the excess part. Same is done at the bottom.
Undercover Love, proudly corresponds. Ma, what is the essence of the envelope folding?
Yes, it will bring beauty to the bed, to make the bed beautiful. And it's a standard. It's a standard in any bed making. If you're taking any exams in maybe School of Nursing and you're asked to make a bed, please, you must bring out the envelope corner in the 4 corners of the bed. If not, you will not pass. So, yes, so.
I will pass.
Hello.
Yeah.
And I think with this style, it will also not let it scatter easily.
Yes. It will not let it scatter easily.
Yes.
Yes. Now my bed is done applying the bottom sheet. I am now going to apply the draw sheet. Here is my draw sheet. It's an improvised though.
It's not well laid.
What? Hello? The bed or
Is this the second layer?
Is it the second layer or the first layer?
She's
Which
saying that
one
the
is
first
not
layer that you
well
did not tuck it in
The
very well.
first layer, you didn't tuck it in very well.
Okay. It's okay.
Where the white one is now.
No, I'm not done with that. Okay.
The place I'm referring to.
Okay. It's all right. Thank you for that observation. So I'm now going to be applying. Hello? I'm now going to be applying the draw sheet.
What is the importance of the draw sheet?
It will prevent the resident from soiling the bottom sheet. This draw sheet should be a kind of Macintosh. You get it? Hello? Like I told you that I'm just improvising. Yes. So this is a kind of Macintosh. Then after the draw sheet, I'm now going to apply the bottom sheet. Sorry, the top sheet now. This is a little one because your resident cannot be allowed to sleep directly or lie directly on the draw sheet. So there has to be something that will protect the skin. And that's what I am doing now. All right. The bed is made. Then I'm going to be applying the topmost sheet. So that as the patients or the resident comes in, this is part of the bed that the beddings that will be open, and the resident will come in. The same thing applies. But this time, you will only fold in the lower side. Like I said, that bed making is this procedure. While I am folding this way, my assistant would have been in the other side, also folding back. Okay, here I go again. Bring out the envelope end. Now, all right. That is an unoccupied bed. Any question? All right.
Yeah, so does it mean the top sheet is what's the patient is going to be using to cover him or herself?
Yes.
For someone finish the spreading the sheet and all the waste we just scatter.
All right, please, not friendship, just excuse me. Yes, I can. I'm listening to what some of us are saying. Can everybody hear me, please? Can you hear me?
We can hear you, ma.
Okay. Yes, the bed dressing in. But someone said it's staffing. Yes, so because we don't go to the cleaner. Anything that's got to do with humanity takes time. Actually, like she has done, bed making is one major skill of a certified nurse assistant. It's very important, like just like vital signs. Out of some of these things are things that you really get to have hands on when you actually are a registered nurse. But something like bed making is important because if you are assessed, they walk into the ward where you are and the bed is not properly laid, it's a minus to you, which I know not to you, but to whoever, just that. So practically that is just it. You know why it's taking time? It's taking time because we have not mastered it. Because anything you master, you do it, you know. By the time she's taking her time to show you, but by the time you get used to it, it does be something you won't take that long. So it's fine. Mr. Araka, Mr. Chukunon, so are you still with us? Mr. Araka? Okay, like we were saying, he's trying to say you can't see anything. I think it's from your end. If your mic is muted, you would be able to see. So we've just seen occupied bed. And unoccupied. Now, oh, sorry, I beg your pardon. An unoccupied bed, a bed that is not occupied, like an empty bed that is stripped down to the mattress. So we are going to see how we can dress a bed or make a bed that is occupied with the resident already on it or the patient already on it. So let's just see. But don't worry, when you get used to all these things, you will be happy doing it and it won't take you a long time to do it. So,
But Ma, from now on, I'm going to be respecting nurses that make bed do. And now see that it's a skill. So when they make my bed, I should say thank you very, very well.
And then the instance where the patient needs assistance with the legs, is it a pillow that they put down for the patient to put his or her leg on?
don't worry, sir. Just we'll get to that. We'll see it. I think that will show you in the next task that we are going to do. You'll see it. It's better you see than me saying it. Let's just watch out for the next one. Okay. Okay. So we need to, someone is saying I was trying to unmute my mic, but they keep muting my mic. I just missed everything about making the bed very bad. Oh, Mr. Araka, I'm sorry for that. Sorry for that. Don't worry. You'll get to have a video. So any parts you have lost out, you'll get it. So let's just take, for instance, you are trying to put the resident on the bed and see how we can lay that bed, make that bed while the resident is still on the bed.
All right. Now I am going to be making an occupied bed. Like I said, an occupied bed is that bed that you have somebody already on the bed. So I'm going to be changing the linen while the resident is on the bed. So I am here in the ward today. I have to start by greeting the patient or the residents. Madam Rose, how are you? Good morning. How was the night? Madam Rose, I want to change the linen for you. Will you love me to do that? Yes, now I have greeted my the person in my care, and I'm now just going to gather my supplies. And here they are already. I'm going to provide as much as I make her comfortable. I don't have to expose my patients. Even when their relatives are with them, I have to excuse whosoever that was with the residents just to provide that privacy. So here I have the screen to do that. I have gathered my supplies. Now I'm going to wash my hands. Washing with soap This time, I don't intend to use gloves. So it's optional. You can decide to use gloves. You can decide not to use gloves. So now I want to be changing the bed linen. I would have done it in the other side, but so that I can allow you a view, I want you to really see what we are going to do. So how do I start this? You take off the pillowcase. Can you see me? Are we together? Hello?
Yeah, we
Yes,
can
I
see you,
can
ma'am.
hear you. Yes, we can see
We
you.
can see you. We can see you.
Please, you have to really follow me. You have to really follow me. Now, this is what I do. You take up the pillow, because first of all, you're going to roll the resident to one side. My bed was to have a bed rail. I would have brought up the rail just to support the resident. But in this case, this bed don't have those rails. So I am going to just manage it in a way that my resident will not fall on the other side of the bed. So please follow me. Now I am going to turn her to a lateral position. I have turned her now to a lateral position. I must have used the pillow to support her because this bed don't have rails. The resident is able to stay. I may not need the use of pillow behind, but if she's not that strong to stay, I will need the use of pillow. But in this case, the resident can stay. Now, this is what we do. Gently, you open it. While doing that, you take off the topmost sheet. I'm taking off the topmost sheet because I want to replace the topmost sheet with a clean linen. Are we following? Hello?
Yes, ma'am.
We following,
Okay.
please.
All right. Okay. Now, the part that will be under her back should be large enough so that when she is pulled to this side of the bed, that part will also cover the entire bed. Good. Now I am done on this side. I'm going to be changing her position to the side of the bed that is made already. Now I will come this way. Madam Rose, how are you? Ah. Are we together?
Yes, ma'am.
All right. Remember, we are making an occupied bed. Now I am done making an occupied bed. The essence of bed making is to provide comfort, prevent infection, and promote healing. Now Mrs. Comfort is lying on a fresh new linen. I have changed the pillowcase. She's lying on a fresh new linen. That is it. Then I will take off the screen and make her comfortable. Mrs. Comfort, are you okay? All right. Please don't fail to call me whenever you have need. So that is it.
Well done, nurse.
Thank you. So, practically, what
Let's clap for her. Let's clap for her. You did a good
Well
job.
done, well done. It's not easy, oh. Wahala.
Wow, I clapping.
Some of us can't see anything.
Nice
Some of us
one.
can't see, please. Some of us can't see.
Please, I don't understand this challenge of us not being able to see, because I don't know. I think who are the
Ma,
people that
we
can-
can't hear you. You are too far from the mic.
I can't hear you, Mao. And I can't see your picture.
Michael, you're obstructing my view.
Please, I have a question. Oh, I have a question to ask.
Okay, please, I need to first know, can we hear me?
We can hear you now.
Yeah, we can hear you now.
Yes, we can hear you now.
Okay, please, I think it's for my Ghanaian brothers and Ugandan brothers that are not able to hear, because okay, someone say why the pillow is not changed. Okay, all right, we are even trying to look at time. Already she said the pillowcase has been changed. So at some of the protocols, okay, maybe we need to go back to start removing the pillowcase and changing it. We didn't think that was necessary, because like she already said, she has said we've changed the
There's no need
pillowcase.
for that. Let's continue.
So we need to move so that we beat time. So practically, please, anybody that cannot see, maybe Mr. Wheeler, Mr. Isaac, because they are non-Nigerians. So I think where you are, the network issue is actually what is affecting you. So, but you will get the video. So someone has a question, please. Who has the question? Madam Queenship, please, your attention is needed. Please go ahead and ask.
Okay, it's me. It's Charity.
Charity, go ahead.
Charity, it's Charity speaking.
Okay,
Please,
Charity.
I want to ask concerning this. The patient now, she's lying down on the bed, and you want to make the bed. Will you start all over, like from the beginning?
No.
Because I see that she did not remove the Macintosh and all that. Will you
No,
start
you
from the
don't
beginning,
remove
or
those
just
ones. You only remove the soil linen. That's the upper linen that you only remove.
Oh, all right, all right.
Yes,
Thank
and
you
do
very
not
much.
forget that there was the Macintosh there, so that will help to cushion any effect of anything. So it's just the upper surface, the toppermost bed sheets that you have to turn. So that's practically it. It may seem as it's just an easy thing, but it takes a lot of time.
It's
It
not
takes-
easy. It's not easy.
For how long is it? For
Even
how long
myself,
does
I'm
it
feeling
take?
for her waist. Thank you very much for your.
For how long will it?
Yeah.
How long will the Macintosh and the rest of the beddings stay before they are changed?
It can
Someone
be
has a prolonged illness.
It can be for 3 to 4 days.
Oh, okay.
Yeah,
That's the
for 3
Macintosh.
yeah.
Change.
Yeah,
fully.
please, and in the case that the patient soils the bed, must the Macintosh and everything be ripped off?
Yes, in
No.
case the bed is soiled, the Macintosh can be taken off, can be replaced.
Yes, because of it depends on the illness the person has. So there are some that actually mess it up. So sometimes it can be changed, sometimes it can just be cleaned, the Macintosh cleaned properly, then laid another bed sheet laid on it to ensure that it's okay. But in a case whereby the person doesn't have any major challenge, like maybe bed messing up the bed or something, then you can take that longer time with them. So I don't know, do we have any question, Madam Queenship, are we?
And where the patient need a leg rest, how is that done, please?
The leg rest. Okay, he had asked that question. He said that what if the patient needs a leg rest? Maybe he wants to sit up on bed, if I understand what he's trying to say. Maybe he wants to sit down, just allow the legs to be suspended down. So what is to be done in such a situation?
You put the patient on bed to sit.
Yes, I know what it means is, I don't know if the bed rests. I don't understand. I don't know if that's what you were actually asking.
I think he said raise, to raise the leg.
Okay,
Yes,
raise,
yes.
not
If the
rest. You
patient
see,
needs-
communication breach.
If the patient needs to raise the legs, we can use pillows.
Pillow.
Yes.
Can use pillows. Sorry, I didn't get you well. You see how communication can be a challenge because I understood it the other way. Thank you. Thank you, Nurse Queenship. So what's the next?
Okay, hello. Good evening.
Yes, good evening.
Sorry, also, if you want to raise, the patient wants to raise her back or his back. Now, the reason why I'm asking is because I have seen it happen when someone was on admission, she had a surgery, and then the anesthesia they gave to him, as in they said she shouldn't put her head flat on the floor. I mean, she shouldn't put it on the pillow, so they didn't put it on the pillow. But after a while, she was asked to raise her back. So I think there's something underneath the bed that has to be raised.
Yes, we can raise either the head of the bed or the leg of the bed. You use pillow. Yes.
Oh, you use pillow. Okay, so we right now have
Times where I saw a patient who has been in bed for a long while and started having sores at the back. So in such situation, what do you do about it?
To prevent sores in the first place, you have to keep changing the patient's position.
Very important.
Very important. You change their position to prevent sores. But in the situation where sores have developed, you treat the sores by cleaning and applying powder or maybe Vaseline.
Please, someone should mute. Someone's mic is on. That's why we are having this check. All right, are we together?
Yes, but we can't see you anymore.
Yes, but there's nothing showing on the screen.
Yes, we made it so. We made it so. Practically, what the nurse, I don't know how people heard her. You remember when we were doing the theoretical aspect, we said that repositioning a patient in bed, we are going to see that's one of the skills now. Quickly, we are going to see. Because if you have someone that is prone to having bed sores, like I thought when we're having, the worst mistake you can ever do is to allow that person to lie for too long. If you don't, occasionally, you have to maybe after some few minutes, 10 minutes, 15 minutes, you have to make the person at least turn, try to reposition the patient to avoid that bed sores, because that is one very common thing that happens to people that are bed bound, especially people that cannot turn, they cannot even move any part of their bodies due to illnesses. Repositioning is very, very important. If you don't reposition, the after effect is the bed sores that we are talking about. The body will start coming out with the bed sheets or with the blankets. So it's very important. So, ma'am, I think we should look at repositioning.
Okay, first.
Yes, repositioning so that it aligns with what we are doing.
Okay, someone was talking about a patient developing bed sores. Bedridden patients develop bed sores when they are not routinely turned. So I am going to be showing us the different positions and how to turn patients to those positions. We have the lateral position, that is the side-by-side positioning. We have the prone position, whereby the patient wants to lie flat on her tummy. And we have the supine position, whereby the patient, like we have my resident here, lie just on her back. You don't have to allow her to lie for so long, whether on her back, on the side, or on the tummy. So now I'm going to be changing this patient's position. First of all, I have to explain to her You don't just come in just because she's under your care. You don't just come in and, you know, begin to carry out the procedure. You have to inform her first. So I am here to inform Mrs. Rose. Hello, Madam Rose. Good morning. How are you? Madam Rose, I want to help you to change to another position. Which position will you love to go? By the side. My patient says she wants to lie by her side. So I am going to help her do that. First of all, I have to go and wash my hands. Please don't fail to wash your hands before you go close to the patients. Either you wash your hands or you use an alcohol-based sanitizer. So I have finished washing my hands. The next thing I'm going to do is to make sure that I provide privacy. I have provided privacy now. So I am going to be turning Mrs. Rose to the side. Madam Rose, how are you? Now, first of all, you have to in this patient. In. Good. Good. Now I'm going to be turning her. How do you turn? Take off one leg first, then take the other leg across. Take the hands across. Then you pull her to one side. Madam Rose is lying on her side now. If she is able to stay, she can do that without maybe a pillow. But where the patient is unable to stay in this position, you support her with a pillow. Madam Rose can lie on this position for as long as you want her to. Please, before you do this, it must be in a bed that has rails. If not, if your bed don't have rails, please, there should be a pillow in front and behind to support her. Now, my patient is lying on her side. That is the lateral position. The lateral can be the right, and it can also be on the left. At the moment, she's lying on the right lateral position. That is for positioning. And if Mrs. Rose was to have a sore, I would have used this opportunity to treat those pressure sore areas. But in this case, my patient is very fresh. There is no sore. So I am changing her position to prevent the development of sores. Are we okay? That is for lateral positioning.
Yes, ma'am.
Yes, ma'am.
All right. Now we are going to go to prone positioning. That's lying on the tummy. What do we do? You take off.
What do you call it?
Prone position. Prone position. The patient will be on her tummy. She has told me she just wants to lie on her tummy as prone positioning. Are we together?
Yes, ma'am.
Hello. Now,
yes, we're together.
Yes. So you bring in the patient close to yourself. Madam Rose said you want to lie on the prone position. You have taken off this. So what do? You cross the hand and you cross one side of the leg. Pull out to
Both
the
of
front.
the other hand. Okay.
Yes, you are going to bring out the other hand. Now I have brought out the other hand. My patient is comfortably placed on a prone position. Are we okay with that? Hello?
Yes, we're okay.
Okay,
all right. Question?
Okay.
Okay. Okay, now I am going to return her back to the supine position. That is lying on her back, which is the common position for almost every resident or recipient of care. So, Madam Rose, you take this hand. Madam Rose is in a supine position. Make sure she is centrally placed. A pillow under her head. Please minimize exposure as much as you can while positioning the patient.
What is this positioning called?
Supine position.
Unified, sorry.
Supine, S-U-P-I-N-E, supine position. That's just lying on your back. We okay with that?
Yes.
Hello. Okay.
Thank you so much for that, for showing us the different positions. Please, this is very, very important. Very important. I'm trying to give you a form of, I don't know, expo. We used to call it expo in those days. So it's very important that we learn the positioning, the three types, like she has already explained to us. The first one is the lateral position. Remember, we talked about placing a casualty in recovery position. If you remember, we did it yesterday in first aid. So that particular recovery position that the person stays, that the leg is at angle 90 and the hand plays the way it was, that position is the lateral position. Lateral. You are going to get it. Don't worry. It's L-A-T-E-R-A-L. That's the lateral position. And then the other position is lying on the back, as she is lying just like this. You see her lying on her back. That is supine. S-U-P-I-N-E, pineapple, supine. So then the last position is the one that you lie face down. Face down, her face, you will not be seeing it. Her face will be down on the mattress. The opposite of what is happening here is the prone position. So those are the three positions. So because someone will not tell you, like she just said, I want to lie on my side.
Did you say prone? Prone?
Yes.
Also.
P-R-O-N-E. I typed it in the chat box already. P-R-O. Okay, and we also have the semi-prone. But in this case, is the prone position, the supine position, and the lateral positions. Those are the three. So a patient may tell you, I want to lie, my neck is paining me, I want to face the mattress. So you, being a professional, you should understand what it means, that a person wants to lie in a prone position. So that's why, thank you so much, Nurse Pinship. I think we can move to...
Ma, please, how long does the person need to lie in a position to avoid bed sore?
It's the patient that decides how long she needs to lie down in any position. Except a patient that is prone to bed sores. You change her position every 2 to 4 hours for patients that are bedridden.
Okay, that's to say that, Nurse Queenship, that's to say that for a patient that is bedbound, like bedridden,
yes,
you have to change that patient at least every 4 hours.
2 to 4 hours.
2 to 4 hours, okay, yes. 2 to 4 hours. But for a person that is not bedridden, maybe just a person that is on bed rest, they say you have to stay on the bed and no movement temporarily, then that person may say, oh, please, I need to turn. I think I've laid too much. My back is aching me or my side is aching me. Please, can you turn me? So that one is at the patient's discretion, like when he or she, remember, we have to take into cognizance that they have to still have control over their lives we have been talking about. So you seek to get from them what they actually want. But when it is a dicey situation where the patient is bedridden, then 2 to 4 hours, it's important. So thank you. So if we don't have any question, let us move. Today we have to do everything we have to do. It's not too many left. So just go, ma'am. We have bed bath. Okay. Now we are practically going to another skill that we need to learn, which is the skill of bed bathing. You know, sometimes we have patients that are not able to go to the bathroom, toileting, to handle that aspect of their lives. So you have to do it. So maybe this Rose is not able to go to the bathroom to actually take care of herself. So we have to, that's what we are going to look at now, how to do a bed bath, how to clean up a person in bed. Ma'am, can we, okay, you can go ahead. All right,
All right.
okay.
We are going to.
So please, let's find out if they can hear us. Are we together?
Are we together?
Yes, ma.
Yes, ma.
Yes, ma.
So we are going to do bed bathing. I'm going to be bathing Mrs. Rose on the bed. She can, you know, she cannot go to the bathroom. So I'm going to be bathing her. Why do we even do bed bathing? Why do we bed bath our clients? We bed bath them to provide comfort. We bed bath them to prevent infection. Just to make them clean, make them feel comfortable. Bathing is one of the activities of daily living. It's one of those activities she would have provided for herself if she was, able. But at this point, Mrs. Rose is not very able here to assist her with that activity. So I am here to tell her, I must inform her that this is what I'm coming to do. Mrs. Rose, good morning. How are you today? Will you help me bath you? All right. So now I have informed my residents. I am now going to gather my supplies. Here is a bucket of warm water and another warm water, which is clean water. And here is my towel, the first towel that I'm going to use. I will use this one in bathing her. Then I will use this other one in cleaning her. Here is my lotion, and this is the soap of her choice. She has chosen this very type of soap. So I am going to be bathing her. Now I go back, I have to provide that covering for her, though she's not able to do it for herself, but I don't have to expose her. So you have to minimize comfort and also, provide that coverage for her. All right. So I have gathered my supplies. You can decide to use hand gloves while bathing her. You can decide also not to use, depending on the condition of your patient. If it's a clean case like Mrs. Ross, I don't need to use hand gloves. Now my water is mixed. Is that you can use your elbow to check the temperature of the water. And having checked the temperature of the water, it is okay for my patient. You can equally ask the resident to test the temperature of the water, because she might like it cold or very hot, depending on the weather condition. Mrs. Rose, please, can you test this water for me? Okay. Okay, she has confirmed that the temperature of this water is very okay for her. Now I am going to start bathing my patients. Please, you have to only expose the part that you're going to work with. You don't just strip her at once. Even when you have provided this coverage, you don't just have to strip her like that. So I am going to be starting from her face. While washing her face, you don't have to use any soap. You use clean water. Now I am going to start washing. This is my clean water. I start by washing the eye area in and out. I do same to the left side, in and out. Then I will clean it. You have to be very gentle, especially on the skin of the face, which is always very sensitive. I am washing the face. I'm washing the neck. Then I'll take a dry towel, dab the face gently, not to bruise the skin. I am done with the face and the neck. Remember, I said you're only to expose the areas that you are working on. I am now going to be washing the breast area. I'm washing the breast area. Please make sure you wash under the breast thoroughly. Wash the flanks and the armpits. Then you use clean towel from a clean water. Gently, you rinse the part that you've washed. And then use a clean dry towel to dry the areas that you've washed. Be very gentle with your residents. I'm done with the breast and the trunk. Now I'm going to be washing the hands. Take up the hand. Look at the hands. Make sure to ensure there is no break in the skin. Where there is no break in the skin, you go ahead and wash. Give attention in between the fingers. Pay attention to the fingers. Then you take clean water. Remember, there is a Macintosh underneath so that my bed will not be soiled. All right. Okay. Now I'll go to the left side. Remember, you are only to expose the side that you will be working on. Observe the skin for lesion or rashes, and then wash gently. You wash. Pay attention in between the fingers. And then you do same to the left side of the body. I'm washing the left side of the hand, having observed the body to rule out the presence of lesion or rashes. And please, while doing that, while doing all this, ensure you keep communicating with your patients. Only expose the area that you're going to be working on. Rose, are you okay? Now I am done washing the upper part. Then I will turn her to the side and I will take care of the back. Clean and dab her back and make her comfortable. Now I am done. I want to start applying cream. You start from the back because you have already positioned her. I'll start by applying the creams on the pressure points. And then I will rub. Mrs. Rose says she can take care of her perineum. So I shouldn't touch that side. I would have done it. But she says she can take care of that side. Okay. Okay. All right. Now,
What
if
if she
she
cannot
allows
take care?
me, hello?
What
She
if she
says she-
cannot take? What if she
Good,
cannot take care of?
good. I am coming to that. If she cannot take care of that, Mrs. Rose, I'm going to help you. If she cannot take care of that, the same temperature of water, the soap and everything, you wrap. I have changed the water. You are going to wrap this . You flex the knees. I am going to be cleaning the perineum for my resident, and my resident is a woman. So what should I do? I take up this, soak with soap.
Can't hear you.
We can't hear what you are saying. No.
Okay, I'm going to be cleaning the perineal area. I have gathered just the same as I was bagging her. So you start from, while doing that, you start from top to bottom. Can we hear?
Yes, we can hear you. You are doing well.
Okay. You start from the labia majora, that is the upper part of the vagina, the outer part of the vagina, rather, that is the labia majora. You clean down one. Then you change. Look at what I'm doing. You change. You are going to clean the majora. Here I go. From top to bottom. Now I am done cleaning the labia majoras, and I'm now going to clean the labia minoras. That is the inner part of the vagina. Again, I change another fold of the of my towel, dip it in water. I clean the right side of the labia minora from top to bottom. Change the fold of the towel again. Dip it in water. Clean the left side, the labia minora. That is the inner layer of the vagina. Now you can see I am done cleaning the labia majora and the labia minora. Now I am going to clean the vestibule. From top to bottom, I clean the vestibule. I am done washing. What should I do now? In the same manner, I will fold this towel. That is my clean water. Clean the labia majora this way. Remove the fold. This side of the labia majora. Remove another fold. This side of the labia minora. Remove another fold. And then this side of the labia minora. And the last fold now I will use to clean the vestibule. That's from the clitoris down to the anus. I am done cleaning the perineum, the upper side. Now I'm going to turn her to the side so that I can clean the anus properly and her bumble. The same way that I did.
Well done, nurse.
Thank you.
Don't be small work.
What of a man must be attended by yes. We do the same if they permit us. If you permit, we do the same. But while washing the back side, you start by washing this way. You don't start from washing the anus because it's always the most soiled part. So you yes. Two, you take another fold. 1, 2. You take another fold. 1, 2, and then the very last fold. You come from this direction, from the anus up. And you're done cleaning the perineal area of your patient. And you make her comfortable.
Thank you. Please, I need to talk to you so that we know.
All right, then I will return all my items.
Thank you so much. Are we together?
I have a question.
I don't mind.
Yes.
Well done. I have a question
too.
Well done.
What
I have a
question. Burns all over her body. Is the person going to take a full bath?
Pardon, come again. If the person has burns.
Yes. How is he going to be bath? Is he going to take a full bath?
It's not bathing.
It's not bathing. You do dressing. If the patient has the burns all over the body, you do daily bathing or daily dressing. So that replaces bathing.
Not the certified nurse will do that.
Okay. Yeah. Yes, it's the nurse.
Registered nurse that does that. Yes, that's what I wanted them to. Okay.
Any
other question? Okay, please.
I have a question. So please, the towel, is it the towel that you're using to clean the body, both the other parts and all that, is it disposable or you have to wash it?
No, it's not disposable. Normal face towel, you have to wash it afterward.
Yeah,
you can't keep disposing towels because you do this morning and evening.
So you have to use the one you wash and make clean.
Yes.
Okay, thank you. But if they have disposables, what happens?
If they have disposables,
they can
you dispose them. You can still use and dispose.
Okay, thank you. So any other one? We have 2 skills to go before we leave. So
where the patient want to ease him or herself.
Okay, what if the patient wants to ease himself?
Simple. We have a bedpan. That's the next thing we are going to do. We have a bedpan. So I am going to be administering the bedpan. Like I said, this patient is bedridden, cannot get to the toilet. So there is a bedpan. We are going to administer that now. But before we do that, you still have to discuss with the patient. Madam Rose, you said you need to ease yourself. Okay, I am here to apply a bed fan for you. Will you love me do that? All right. So I have discussed with my residents, and she said she has accepted that I assist her to put a bed pan for her. So I will gather my supplies. All what I need is just the bed pan. It's just the bed pan. I need my gloves. And then the tissue paper.
No, you just maybe tell them you wear your gloves so that we beat them.
Okay. Then I have gone to wash my hands. Then in this procedure, you have to apply the gloves. But for the purpose of time, I may not go that far applying the gloves. So you provide that privacy for the patients. It's assume I have worn my gloves.
Yes.
All right. You will just take this patient to one side, the side away from you.
That is a bed pan, okay?
This is a bed pan. I apply my bed pan, bring the patient to be centrally on it, make her comfortable, raise the head of the bed.
So that's head of the bed. It's not, they are not seeing the head.
So at this point, after raising the head of the bed, I have to remove the glove. I have to remove the glove because I don't need to touch her with the contaminated glove. Then I will just remain with her. And when she is done, she tells me, as my client has told me that she's done, before removing the bed pan, I have to lower the head of the bed. Put on my gloves again. Remember, I have put on my gloves. I'm going to be removing the bed pan. Then I will roll my patient to the side. Clean her. Then I take off the bed pan. Remove the gloves again. Then bring her to a comfortable position. Put on the gloves again. I now carry the bedpan to the toilet
and empty.
So empty. Then I will now sterilize the bedpan for further use. I'm done applying bedpan for my patient that is bedridden.
Okay, ma'am.
Any question?
I think we don't have because our time. Okay, thank you. I think we should go to catheter.
What about the male patient? Is it still going to be the same way?
Yes,
the male
it's the same way. It's the same way while pooing.
All right. Thank you.
Yes, we have a
what about women?
Women, for women, you still use the same bedpan. But for men, we have male urinals that has a hole that the penis can be fixed into. And just that.
The same thing. So now let's go to catheter. Please, today we have to just do everything we have to do. Nobody should leave so that you will not lose out. We just have 2 more skills, 1, 2, and we are good to go. So bear with us while we do it. And what to video. Okay, so right now we are just going to see, this is about the last or second to the last skill. As fast as possible, we are going to see how to deal with catheter. You remember we said surgical procedures, CNAs are not supposed to do that. But taking care of the catheter is part of our duty. So we are just going to, in the next few seconds, we are going to see how we can take care of the catheter, how you can clean, and remember too, you have to record, document to show you are doing your duties effectively and efficiently. So thank you for your patience. I'm really glad that I can still see 30 participants. It's making me happy because I thought some people would have just left, you know, but that's to show that we are really involved in this humanitarian service and we are ready to do it. So we are going to see how to, are we good? All right. Okay, so over to you, ma'am.
All right, so at this point, as one of the responsibilities of a certified nurse assistant, you're going to assist the patient in cleaning the catheter and also releasing the urine. Catheter is applied for people that have that difficulty, maybe in passing urine directly, or people that cannot leave the bed to go to the toilet. So Madam Rose here has the catheter on. So my responsibility is just to empty the catheter and then clean the catheter side so that she will not be infected. Before I do that, as usual, I have to inform her. Mrs. Rose, I have come to change to check your catheter. Are you okay with that? Good. After informing my patient, I will provide that privacy. It is very, very necessary you provide privacy. Then, as part of infection prevention and control, I am done washing my hands. This is more like invasive procedure, so I am going to put on my gloves. For this one, I must put on my gloves.
Okay, so we'll not look at time anymore. We have to wear the gloves. I don't glove. That's why I was saying this, and so that just tell them.
Okay, assume I have put on the gloves.
So that we move, yes.
So now I am going to be emptying this urine bag. Before I empty this urine bag, remember I have put on my gloves. Before I have emptied this urine bag, first of all, the urine bag has to be below where the bladder is. It has to be below. This is my patient, this is our bladder, and this is where the urine bag is. Again, this urine bag does not have to be on the floor. It has to be somewhere. Like
I can't see anything again.
Okay, can we all see? Every other person, can we see?
We can see.
We can still.
Okay. Just mute. When you mute, you'll see, please. Or maybe it's
Mrs. Rose has a catheter on, so my responsibility is to clean the catheter and also empty her urine. But before I empty the urine, I have to check the amount of urine that she has made. You know, caring for a resident, you have to monitor her intake and output. How do you do that? You have to check the amount of urine that she is making to be sure that it coincides with the amount of fluid that she has taken in. And in a normal person like Mrs. Rose, she is expected to make between 800 to 2,000 milliliters of urine per day. Anything below that calls for a consent, and anything above that also calls for consent. So now I am going to look at the urine bag. I am going to take the reading on the amount of urine that Mrs. Rose has produced today. Here I go. I pick up the urine bag. As you can see with me, Mrs. Rose, between 6 a.m. and 2 p.m., she has made 1,000 mils of urine. What should I do? I'll put it back, document what I have seen, that Mrs. Rose has made 1,000 mils of urine in 6 hours. Because she has taken a lot of water and she has taken a lot of fluid. Now I am going to release the urine. You don't have to allow the urine to be so full, because if it is, it will kink back into the bladder, which brings about infection, discomfort, and all that. So now I am going to release the urine back. Before I release the urine back, I have to bring the urine out. Remember, I have my gloves on. They are not seeing. Can we see? Hello?
No.
Yes,
we can. Yes, now.
Okay, yes, urinal. Here is the urinal. I'm going to put it down. Then I take up the urine back that is already filled, about 1,000 mil. Here is what I do. You release the knob. After releasing the knob, you turn the urine back to the urinal, and here the urine is being emptied. Just be patient so that the urine bag can be completely emptied, and that will help your further observation of this patient. Are we together?
Yes.
All right. Yes. Make sure the urine is completely empty. And then this urine bag is completely empty, and then you put back the knot and send it back to the reservoir. Then you pick up the urinal to go and discard the urine.
Thank you. Thank you so very much. Thank you. Do
Any
we have
question?
any questions or anything? Then we take the last skill, the very last skill, transfer, how to transfer a patient from the bed to the wheelchair. With that, we wrap it up. Do we have any questions? Can everyone hear? It's like they're not hearing me anymore. Can we?
Are we together?
We're together, we're hearing you. Please proceed.
We can hear you. Okay.
Any question?
No question.
Okay, so let's go to the
Brushing of teeth.
This rushing, you said no question. How are you sure we don't have question?
Ask your question.
Oh my God. Okay, brushing of teeth. But let's take the last skill. If we
No,
take that one, then we can.
I
do
also
the-
have questions too.
Oh yeah, ask your question.
Okay, my question is, she talked about having a particular quantity of urine that is expected, and also, it has to equate the amount of water, or you question the amount of urine. If it's less, you question urine. Can you hear me?
Yes.
Okay, that if it's less, you also question it, or it calls for investigating. Now, my question goes, I actually think the volume of water you take will propel the quantity of urine you have per day. If I am wrong, I don't know. But if she had taken if she had taken a lot of fluid and she has more urine, does it cause for alarm? Is there cause for alarm? Since there's a particular quantity of okay, because she talked about
that is
200 to 2,000.
No, but that's it.
Whether
it's
hello.
Yes, I'm with you.
I said that the amount of water that the resident takes in should be equal to the amount of urine that he or she produces in a day. Did you get to that point?
Like, I got to that point, but where I have issue or where I have question is where you talk about the quantity to be 2,000 something, I can't remember.
Yes,
to a certain,
normal
that if it's less, you question. If it's more, you question. That's why I have my.
Well, good. In a normal human being is expected to make 800 to 2,000 milliliters of urine. That's 2,000 2 liters of urine in a day, and that is subject to what is taken in, like water or fruit juice, anything that has water in it. But where your patient has taken in much and is not producing much urine as expected, it calls for concern. That's one. Two, where your patient is not taking in much, but is producing much urine, again, it calls for consent. Are we okay? Hello?
But our duty is just to report now. It's not for us to be.
No, you don't do anything. You only report. That's why I said your own role as a CNA is just to monitor and help where necessary, but you don't do anything, just report. That is why documentation is very, very necessary, because what is not documented is not done. So document at every given contact, document your findings. That will help the nurse or the doctor to manage the patient well. Are you okay?
Thank you, Manos. You've done a good job. Let's look at ambulation transfer. If we have that, just moving from bed to wheelchair, that's the last thing. Sorry, sorry, we just want to take the very last one, and then we are done in the next few minutes. Thank you thank you for the understanding. You mean her waist? The nurse, she does a lot of exercises, so she's very fit. Forget you are seeing. She can bend down and do 360. 360.
I mean myself.
Okay, your waist. Okay, sorry. We'll soon be done.
Okay.
We'll soon be done. Sorry.
Okay, at this point, Mrs. Ross wants to come out of the bed, and at least, as in she wants to sit out, I want to make a bed for her. She doesn't want to stay in the bed this time around for the bed to be made. She wants to come out of the bed and she wants to sit on the wheelchair. So I am here to bring her out to sit on the wheelchair. Mrs. Ross, you say you want to sit on the wheelchair? Okay. So what should I do and wash my hands? I am done washing hands. do I need? It's just a wheelchair and they get belt. Somewhere, somehow, you get to find the get belt. At this point, we don't have the get belt, but I'm still going to bring out my patient. All right, the wheelchair is here. You have to ensure the brakes. Lock the My wheelchair is in good condition. Now I want to bring this road out. First of all, you bring her legs out. Bring her to a sitting position. And then bring her to the edge of the bed. Now I'm going to be lifting her to the wheelchair. I take hands to be on top of my shoulder. She's in you. She's not. She'll just put her hand. 1, 2, 3. I lift her to a standing position. Then I move her close to the wheelchair. And Mrs. Rose is seated on the wheelchair. I bring down the foot back. Mrs. Rose is comfortably seated on the wheel to strengthen the buildings, and I change what I have to change.
Thank you so much. And I talk. From the first aid up until now, which ends the nursing aspect of the skills. So at this point, do we have any question to ask? Do we have any contribution to make? Because we have come to the end. Nevertheless,
how do we return her back to the bed?
Okay, taking back to the bed. All right. Fine, it's
Okay.
easy. So let's do that before you
Now
ask.
I am done dressing the bed, and my then was simple. Turn the leg back. All right.
Let's do the returning. Then when we are done, we can ask.
In the same direction, she put her hands on that. I wrap my waist, lead her to a standing position, and put her on the edge of the bed. And then take back to her position in bed. Make her comfortable. And then release the brakes. Return the wheelchair.
Thank you so much, Nurse Winship. That's beautiful. So the question, I think Mr. Mila, if I'm not, is it Mr. I'm not
Newman.
sure, but you can ask. Okay, please ask. Please ask your
All right.
question.
Okay, thank you so much. Please, my question has to do with the lifting of the patient from the bed and then helping her or him to sit, I mean, in the wheelchair. Looking at the lifting, the positioning, I don't know how the arms were wrapped around your neck and then the positioning. If someone happens to chance on you, wouldn't the person think otherwise? Assuming you are a male CME, and then your client happens to be
Those are some of the ethical issues in nursing care that are still yet to be resolved. Those are
I have a question.
All right.
My question is related to what he also just asked. So one, there are two. One, if the person is horrible, as in you are just one lekpa nursing assistant managing your weight, and then you now have somebody that is bigger, will the person just collapse on you by the time you try to lift?
It will not collapse. That brings us to the use of the gait belt. Before lifting an honorable person, you have to make use of the gait belt.
You think of the load, yeah. You think of what you're about to. So you use the gate belt, or you call for help. There are other ways. You call for backup because you are afraid you
please, did we do gate belt here today?
No,
we didn't because it's not available.
Yes, that's what I'm saying. You can use, even if it's not, you can equally use a belt if it's not. But for now, it's just the same procedure. In a gate belt, you just wrap the belt around. Please go ahead and just wrap the belt around. So it's just the same thing. In the absence of a gate belt, you can use that particular one, that particular way that you have just been taught. If there's a gate belt, it's just simple. Just as you put a belt around, you wrap the belt, and with the help of the belt, you lift the person. It's easy. Or you call for assistance. There are other things too we can use. Remember when we had the theoretical aspects, we have a picture of a couple of those things that you can use in the process. We also have high-tech equipment that you can use to lift a person, but that one is in advanced, very serious advanced stages where the person has maybe spinal cord or severe injuries that will affect the bone. So that is it. Okay. Practically. Do we have any other?
Thank you very much for that answer. Yes.
Yes, please, I have a question.
Please let me ask my second question. Very important. Okay. So, Maz, what I saw from the practical is that a female CNA can bath, clean up a male CNA. Am I correct?
Yes, you can do that.
And yes, a male CNA can as well also clean up a female CNA. Patient.
That is dependent on what is practiced
and what the patient wants.
And what the patient wants.
Yes, what will be comfortable with the patient. Now, I think what
so what if okay.
If I understand your question, don't worry. I know what you want to say. There are ethical dilemmas. You know, these things happen. It's just like you are going to render first aid to someone's wife, and you are trying to do the kiss of life, and the husband comes. The problem with that, so permit me to use pidgin English. But some of these things happen because the situation overrides some of these biases we have. When someone is struggling between life and death, or someone is not, all those things, it's really irrelevant. But, well, a male CNA can attend to a female patient. A female CNA can attend to a male patient. It depends on certain factors, like we talked about during the theoretical aspect. What the patient is most comfortable with. There are people that they will not bend anything, regardless of the fact that they are ill. They may still insist that they will need a female. No, I don't want, I need. So in such situation, we take into cognizance how the patient actually feels and what the patient actually wants. But in the absence of that, where the situation arises that you need to attend to, you are sworn to, is like a lawyer that is sworn to secrecy. You don't divulge any information. That's how a male should be. So at that point, you are doing your duty. You are not thinking, there's nothing should by any means be in your head. Your paramount interest is to ensure that that person is actually given the best care possible at that time. So these are still ethical dilemmas that come into play in the profession, and we are still seeing how to tackle it. But since we are looking at humanity and we're looking at human life totally and generally, that's the total picture. So some of these things, we override them and do what you have to do. So I don't know if that has answered you, ma'am.
Yes.
Okay, so that is, I understand how you feel, but that's just it. It's just like a lady in labor. You will not go and say it's a male doctor. When the labor starts, your brain will reset, whether it's male, whether it's man, or you not know, because labor will just make you know what you have to know at that point. So that's the way it is. You want to help a person, some of those things don't come into play, but they are important equally. Depends on what the patient wants. Thank you. So do we have any other questions?
Ma, when is the exam?
Please,
and
hello.
Are we doing any pre-exam, any pre-test, or I don't know.
Okay,
Any prep
the exams,
for the exam
Please, I
and
have
all
a
that.
question. I have a question as regards what this lifting, putting a patient on the chair.
Okay, please, can you just hold on? Let me attend to the exam question. I'll be with you. So the exams is going to be on the 24th of August. It's on a Saturday. I already said it when we started. I took time to really explain. It's going to be on the 24th. It's CBT test. But before then, after the practicals, before then, you are going to be expected to send a video picking any of the skills that is most appropriate for you that you have learned. Any one at all, hand washing, doffing and donning of gloves, repositioning a patient, any of the skills at all that you have learned. And again, take notes, the one you can do best, that you can ensure that you don't miss any step all the way. Is important so that you can get at least 350 over 500. So your score, your video practicals will be added to your video practicals will be added to your CBT test to give you a total over 500. So that is just it. But don't worry, we are still on the WhatsApp group, and as it is, I'll keep posting you what we know how to do best at Smart Solutions. We'll keep you updated as to how, whatever, all the step of the way, we'll keep you updated. So that is it. Please, madam, you can ask your question concerning the lifting. Thank you.
So please, thank you. So how do we, if a patient cannot stand, how do we handle that? Because there was a time I had someone in my house that couldn't stand because she had a surgery on her leg. So how do we, and we wanted to lift the person to the chair. It was a bit difficult. So how do we do that?
If the patient cannot stand, you lift the patient direct from the bed to the wheelchair. One lifts from the bed down to the wheelchair.
Okay, I don't know if she heard. What she's saying is, sorry, we have rain. So the rain is actually going to disturb our sound a little. But can you hear what she's saying is that if you have a patient that cannot stand, so that process of saying lift and stand is not going to be there because the patient cannot stand. So in such a situation, you weigh the patient very well. Like we said, it will be very funny for you to fall together with the patient. The drama will be too much. So you will just lift the patient, depending on your capability, from the bed directly to the wheelchair. If you cannot do it alone, you call for assistance. You call another person to assist you in lifting the patient from the bed up on top of the wheelchair at once. So all these things, it depends on the particular illness and the particular challenge that your patient has. So you will know the best way to address any situation that arises based on that. So I think we are good to go. Are we? Is there any other? Please, has that answered you, ma'am?
Yes, thank you very much.
Okay, so any other question, please, before we hand over?
Yes, I have a question. You said the exam is on Saturday, 24th.
Yes, it's on the 24th of August.
I'll be going to work, so I don't know. Saturdays, I go to work on Saturday, so I don't know.
Yes, the exam, that's why I said that every communication will be communicated to you. What normally happens, let me ask, when you go to work that Saturday, do you eventually come back?
I'll come back.
Or is it that you work offshores? Because there are people that go and then they stay offshores. Okay, but if it's a job that you come back, the exams last for 24 hours. What do I mean by 24 hours? The exam lasts for 1 day, but it is a period of 3 hours. Just 3 hours. That's to say that you may decide to start the exams by 10 a.m. You may decide to start the exams by 7 p.m. You may decide to start the exams anytime within the 24 hours in a day. But as soon as you start the exams, as soon as you log in with your username and password, you have 3 hours to complete that exams. After 3 hours, the system locks you. So I don't know if you understand. That's to say, even if you are not around in the morning, we make it flexible. Fine, you may decide to do it when you come back, maybe 6 p.m. in the evening. But make sure that when you count your 6 p.m., from 6 p.m., you add the 3 hours. It does not take you to 12 midnight. That will enter another day. That's what I mean. But anything within the day, anytime at all, from 10 a.m., the portal will be open. So you can take your exam anytime. And the exam lasts for 3 hours. After 3 hours, if you don't finish the exams within 3 hours, the system locks you. And when it locks you, it takes that score. If it locks you at 10%, God forbid, it means that's the percent you are having. So that is just, that is it.
Sorry, I want to ask.
Please, how many questions? How many questions? How many questions?
Hello,
Yes, please.
hello, I say I want to ask. For example, if I should start by 10, maybe around 11, I get busy. Can I still log out and come back for it?
No, once you log into, that's how CBT test is. Once you log into the system, you can log into it. Maybe you finish 10 questions and you feel like easing yourself using the toilet. You leave it, you go and ease yourself and you come back. It's still within your 3 hours. But if you lock the system, maybe you lock 10 to 11, you have not finished, you shut down. And then go and do what you want to do and come back again to start entering with your username and password to continue. You will not be able to do that. So whatever you do, like we tell people, you have to make sure that you are free within that 3 hours. Nobody disturbs you. You don't have anything to really do. So you sit down and know that this 3 hours is to take the exams. When you start, you finish. You can even finish within 1 hour. It's not a must that you must take 3 hours. Even if it's 30 minutes, you finish. Once you are done and you get to the end of the question and you have finished, it automatically takes your score at the end of the question. And you know you have. So when it takes your score, you cannot go back to take the exams again for any reason. So that's what I'm saying. But whatever question you have, since we have come to the end and our time is fast spent, anything at all, drop on the chat box and I will keep you posted. The exams is 24th. By next week, from Monday, you'll be getting information on the platform, your username, your full names, your emails, anything I want, I'll ask so that your username and your password can be formed at BCC UK. When they form that username and that password, that's peculiar to you, that you use it to take the exam. So don't worry. You can chat me privately if you have any hitches. You can reply on the group. You can ask your questions there. I am just going to ensure that the exam process is seamless as it has always been over the years. Thank you. Yes, sir.
What happens if I get 500 over 500? What happens if I get
1,000? You can even get 1,000 over 500 if there's anything like that. And I'll be happy. That's the good thing. I will be glad that the students from us are really ready to face the world.
Will it be on my certificates that I am exceptional?
Why not? Your grades is there. If you have 500, it will tell you your grade. If you have 350, it will tell you your grade. Distinction is there. We have samples of the certificates. So look at it.
All my participants, don't worry yourself. It's so simple. Just go and read your book. You pass.
Yes, you know why
How many questions are there? How many questions?
She has said she's saying so because she has taken other exams from BCC UK CBT. So she knows how it is. It's very simple. Even the people that did caregiving, simple. It's just for you to know what to do. They can ask you a simple question. By repositioning a client, what do you do? A, lift the client. 2, push the client. C, kneel down beside the client. You pick the correct option. It's just a simple thing. You click on it and you move. It's to have the practical knowledge. But where you have to spend time is the video. You have to spend time to make your video good because your score will be added to whatever you get. If you get everything all over all in the CBT test and you come to the video, you don't perform well, know that you will not get that distinction or that that you are outstanding that you are talking about. So these are the things that we need to know.
Hello,
do we have any other thing? Yes,
Hello,
please.
Ma. From what
Yes,
you just said,
do you have
to?
From what you just said, that means
Yes.
it's an OBJ, not a written test.
That's why I said it before, that it's multi-choice. Multi-choice, that's objective. A, B, C, you move it, you click on it and move. You click on it and move. Where you have to take time to do the practicals is the video that you send to them. That's the one they will now check for the skills. If you are talking about hand washing.
The video, are we supposed to talk to explain the video or they just want to see pictures of you doing something or what?
No, if a video you are doing a video, like you want to talk about hand washing, you say, okay, my name is Joy or no. I want to talk about the proper way to wash hands or proper hand washing. That is the skill I want to talk about. Now to wash your hands, you need this, you need this, you need that. You need running water, you need soap, you need that and that. You talk about it. Then to start washing your hands, first, this is what you do. You rub the soap in a circular form, you move your hands. That's how video is. You will not just be doing it because you don't expect them to know what you are doing. So that's just it. It goes with your voice. Very short, just very short. You don't have to do too much. Please, do we have any other question? Because we are... Okay, if there is any other question, please drop it on the platform so that we can call it a day. At this point, I don't know, I just want one, because we have a member, we have someone on the from BCC UK that has been with us today. He wasn't around yesterday. So I just want to find out, I just need one person to respond, and maybe one or two, a male and then a female, before I hand over to BCC. I mean, I beg your pardon, to MJB management, to say something about the practicals. It may not be what you meant, but how have you seen the practicals, and just something, if we did well or we didn't do well. Thank you. Who is going to do that for us? A female first, ladies first.
I can go.
Yes, please, go ahead. Anybody, you can go, ma'am.
The practical took us 360-degree away from theory to actually, seeing live what we need to do. In fact, the way it was rendered is such that we are in the studio. It's as though we are right there, with you actually doing stuff. So it's not like a practical that was done online. It's more or less like we are there, feeling all the all the different scenarios.
Yes.
From the
Thank
CPR.
You so very much. So you've spoken on behalf.
This was the first time that CPR, I've been watching videos, but this one was real, the way it was rendered. So really appreciate.
Thank you so very much. Thank you. Please, I need to know the people that talked on behalf of the women. Please, can you tell us your name?
My name is Patience Gold.
Okay, Patience Gold. Thank you. You spoke on behalf of the women, and another lady's voice in the background. Who was that?
Mabel.
Okay, Mabel. Wow, beautiful voice, Mabel. Okay, thank you so much. So the men, because this thing is not a woman's thing, and I know Mr. Miller and others ask. So a man, please, should just help us. Let's not be gender sensitive here. Please, a man. It will be sad if you don't have any man, or not even one. Have the men gone to prepare for? Have they gone to look for how to keep food on our tables? Is there any man? Okay, so men are talking. Okay, a man was actually talking because I did not, but I didn't hear. Maybe network. Can you be louder a little bit? Okay. So if we don't have any man, it's fine. There's no issue. So let's take that the women were the ones that actually went home with something. Okay.
Oh, it's been a great experience.
Well, brother Isaac.
Okay, Mr. Isaac. Okay, Mr. Isaac. Thank you.
Hello, madam.
Yes, I'm hearing you, Mr. Isaac.
No, there's new Ben.
Okay, new Ben, Alex,
Yes,
Mr.
ma'am.
Alex.
Yes, please.
Okay, go ahead, sir. I've missed your voice all along. Go ahead, sir.
I've been around. It's been a wonderful one. We really appreciate the efforts you put up. In fact, you are doing a great job. You are doing a great job. This is my first
Mr.
time.
Alex.
Coming across you. And I hope to continue with you. God bless you so much.
Thank you, Mr. Newben. And the Smart Solutions, we are good. So any training you have from MJB Management and Integrated Services, from Andy Smart Solutions, all the trainings, you are sure to have something worthwhile. You are sure to have value for your money. And just for those that may be interested, we have a training coming up, certified healthcare assistant. That's another training, just like the CNA, just like the caregiving. We have it coming up soon, maybe by next week. So when you if you need any information as regards that before the ads actually come out, you can reach out to Andy Smart Solutions or reach out to me directly. Thank you so much. It's been so beautiful and wonderful to have you be with us up until now, especially the patience people, because patience is actually what is needed in this profession, patience. So thank you for being patient to stay up until the end. I wish that everything that we have labored for, that will actually come out successful and will continue to serve humanity in our own different corners. Thank you so much. And at this point, over to MJB Management and Integrated Services. Thank you.
Oh, Doctor, thank you so much. Thank you so much, Dr. Dorothy Kingsley Tigudo. It has been a wonderful time. You've made everything so simple and easy. We've heard from our participants that it was a wonderful ride. Our participants, we appreciate you so much for this new development, because the new development, you are moving ahead. And I tell you, when it comes to recommendation, we'll give our recommendation. Till next time, there's a lot of courses coming out, so you continue to check on the group. Our doctor put it on for us to see, for you to see, in case you are interested in anyone. Do have a lovely night rest. God bless everyone. Good night.
Bye.
So, Madam Dorothy, please, I'll contact you afterwards.
Okay, thank you. I'll be there
You're
waiting.
welcome. Yes, please. Thank you so much. Yep.
Thank you, ma.
Bye. Yeah, you said bye. Is there any question? Someone is still talking. Bye. Let me see. Oh, Manos. Manos, I will remove your head and put in this my head. Right? I'm going to remove it. Sorry. Sorry, and this Saturday in the end of the day that I didn't have a lot of things. Thank you, everybody. Thank you. Thank you. Okay. Manos Ben for me, Garo, Minke, and I in the time for better because better than and the young, I better than the walk it in. I need to too comfortable. Climb now, climb two legs.